right. That's what I thought. All right. All right. Hey, everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, today we have one of our favorite features on Chef AJ Live. It's McDougall Monday, where we are graced with the presence of both Dr. John and Mary McDougall. Before I introduce him to the show, I'd like to introduce a special guest who contacted me. The same thing happened last month when Dr. McDougall was on. We got an email from a gentleman who said, may I please have a few moments with Dr. McDougall to give a testimonial how his work has changed my life. And it was well received. And now people are contacting us regularly to do the same. Please welcome John. God, I just said DiTarcio, John DiTarcio.
Thank you so much. Thank you so very much, Chef AJ. I know everyone wants to get to Dr. and Mrs. McDougall, and I will be as brief as possible because I also want to get to Dr. McDougall, but I am so grateful and so honored that you've given me this opportunity to thank Dr. McDougall for so much that I hold dear. I work in the television industry as a director and a cinematographer, and the job requires a lot of travel and it's physical. And Dr. McDougall, you have given me the tools I need so that I've been able to keep the energy and the strength to still have this career. While most of my peers are decades younger or long since gone, I truly cannot thank you enough. My mother was a native Korean and my father a first-generation Italian. They met during the Korean War, and I was raised in Asia, born in Japan, spent the middle years in Okinawa, high school in Korea. Up until then, I was a pretty healthy kid, but then I went to Tucson, Arizona to attend college, and the story changed. Everything I learned after 10 years of living here in America, I had gained 65 pounds. Now I realized from everything I learned from you that my diet had gone from being a mostly old school Asian diet to an American diet. I wish I knew you then, doctor. I spent the next 23 years yo-yoing up and down and fighting the fight. And I continued to get progressively healthier the older I got. And I was always trying because of my career, which I wanted to keep, and because of my family history. My father was 61 when he died, and he was one of 5 kids, every single one of them, as well as his parents, all dead of heart issues before they reached 60. That's the age I am now. And that always haunted me. It was really traumatizing, and it motivated me to stay healthy. And I followed my doctor's advice, which was exercise more, eat less food, increase the pills. I was put on cholesterol medicine at 30 and blood pressure pills at 33. Yet my health continued to worsen until I stumbled across your TED Talk from 2012, and I'll never forget. The lights came on, and you appeared so beautiful and statuesque in that tan suit, and you declared, starch. Boy, I was hooked, doctor. After that powerful and amazing presentation, I knew that my life had already changed. Immediately, I looked you up online, and wow, an entire universe of information that I'd been looking for came flooding in. From that day forward, I simply followed your advice, and I got healthy. I started eating the foods that I loved as a kid, but feared as an adult. I soon was prescription-free, and all the health came back. And it's not just me, my whole family is all in, and we all reap the rewards, and we approach it as our hobby, and we have a lot of fun with it. And so at home, the McDougall lifestyle isn't hard because the food is so delicious and satisfying, as you tell me all the time. But eating this way on the road is really excruciatingly hard because society makes it so, and I know I'm not telling you anything you don't know, sir. I am the first to admit that when I'm in a hotel room like I am now and my team is out having dinner and I'm in this room washing potatoes in the bathroom and opening up a can of corn while they're sitting out somewhere with nice tablecloths and silverware, I can tend to feel pretty sorry for myself. But during those times, what I need more than anything is some inspiration. So what works for me is I go online, I turn on your videos and Chef AJ's videos, and I listen to you preach. Not that you're preaching, but I do feel like I'm in church and I get inspired like that. And it doesn't matter how many times I hear your lessons. Every single time I watch, read, or listen to you, it gives me the strength and inspiration to get on to the next day. It has occurred to me, doctor, that my wife and I pay $1,500 a month for basic health insurance. And up until now, not much in return for it. Meanwhile, a few bucks a month gets me YouTube. And here I've learned from you how to literally save my own life. And I'm not exaggerating one single bit. I wish there were bigger words. So on behalf of so many out there who share parts of my story. Me and my family, we thank you a million times over, sir, from the bottom of our hearts. I wish there were bigger words.
That's
Thank
great,
you,
John.
Chef AJ. Thank you, Dr. McDougall. Thank you, Mary. It's an honor to meet you.
Let's do that documentary.
Let's do it.
All right, and thank you very much. You made me feel real good for the rest of the day. It's, the greatest reward is helping other people. And the message is so stupid simple. It's the food. It just fix the food. It always happens. You get what you deserve. So anyway, good. Nice. Thank you, John.
I can't tell you what an honor it is to be sitting on my screen and seeing both you and Chef AJ here in front of me. It is really, really, truly an honor. And thank you so much.
So John, what's it like for
great.
craft services? What's that like on the set? Do they have anything vegan and healthy?
I know, Chef AJ, you know this because I know that you have a history in showbiz. So you're feeding me that line. You know what's in there: potato chips. And the people who are going out for the shopping are the young PAs just graduated from college. So of course they're going to buy the big things of chips and anything that's in a package. I mean, and then for the healthy foods, it's the power bars and bags and nuts, maybe a piece of fruit or two there. So I stay clear.
Have you ever worked on a set or a show where it was vegan friendly or anyone self-oriented?
Yeah, the show that I've been on for 10 years, everyone is very health oriented. So and we've been on this show for 10 years. It's a small crew. Show's called Catfish. And I'm the only one who completely understands Dr. McDougall's message, your message. But they're all very, very interested, and everyone tries. So yeah, we do have a pretty healthy crew, but I do stay clear from the catering and and all that stuff. I make the food myself in my hotel rooms. In fact, right here, that bag right there is full. That's my kitchen that goes everywhere with me and has all my utensils and all the tricks that I need to get me through the road.
Do you travel with an Instant Pot?
That used to be my Instant Pot, and everyone knows it as, and they always fool me like, oh, the Instant Pot didn't make it. But I've actually moved on to, I need faster ways to go about it. So I do carry a lot of microwavable brown rice and white rice and cans of beans and corn. And then I always try to find a grocery store and I buy frozen vegetables and I just microwave it all together. And like Dr. McDougall said, you eat like this. And of course, a potato mitt, sir. I would never, ever leave without a potato mitt to make myself potatoes. But I never, as Dr. McDougall says, I never tire of it. And in fact, I cannot tell you the amount of times the crew members go, boy, I wish I had what you had. That looks way better than what we ordered.
Well, I bet they wish what you had in terms of health too.
I think they all waiting to get older. Since I'm about 20 years older than the youngest people on my crew, they all think they have time, but various degrees of that.
Right. Well,
but I do believe it trickles down and people learn and they hear the message and they get better. And I see my crews getting better and better. All thank you to Dr. McDougall. And I have a personality more like Dr. McDougall. I'm not one that just goes, oh, I'm doing my thing. Don't anybody worry about me. If someone asks, they're going to get an earful of it. And I one person at a time, doctor, one person at a time. We're getting your message out.
Thank you. Yeah, it's a battle that needs a big army.
Yeah. Well, I'm your field general. I'm out here fighting the fight, and I'm so grateful. Look at all. I mean, I just have, as you can see, I have a lot of energy.
Wow.
And I'm so grateful every single day. I'm so grateful to you, Chef AJ, and your message. And I thank you. And now, of course, I can tell Chef AJ needs to move on. You need to move on because people like me need to hear the rest of this.
All right.
Thanks so much, John.
Thank you so much.
Take care. So, Dr. McDougall, you have fans everywhere.
Well, it's I can't tell you how much I appreciate it. People often come up to me and they say, I'm sure you're tired of hearing this. I go, no, I'm not. I love to hear that I helped other people. Who wouldn't? What a reward to be able to have a gift to give other people to make their lives better. I'm the luckiest doctor in the world. My patients get well. You heard me say that. So yeah, it's great, AJ. And I have to say, the people who have negative things to say either don't appear because they've moved on, or there are very, very few of them. And I think it's probably both. You know, people who give a sincere try, like John and you and many of the other folks out there, you discover the truth. And then you never look anyplace else for an answer, because this is it. I mean, you understand that starch is the center of your meal plan, that, you know, animal foods and oils and dairy and et cetera, these are things that most for special occasions. And then you can pick the days you're sick and you can pick the days you're well. You know, it's a really, really stupid, simple, cost-free message. And that's part of the problem. People want a sexy message. They want a Star Wars message. They want something that has some financial attachment to it. I don't know. Somebody can make some money off of it, then they'll tell you all about it. But it's the truth. It's been the truth known for 10,000 years. People live on starch-based diets. You are a starchivore, a starchitarian, a starch eater. Until you figure that out, you're dead in the water.
Like you say,
I really mean that, dead in the water.
The truth never changes, like you say. How do people the show before you, Dr. McDougall, was about a lady in Kenya, and she was talking about the Maasai. They don't live very long.
I don't know how long they live, but I do know the story of Maasai. They were studied by George Mann. And George Mann went down and studied them at the invitation of the meat industry and on their dime. And the reason they sent him down there, George Mann, was because the Maasai are a rather unique population of people in Africa that eat a diet of meat, blood, and milk. And they started at their puberty years, and they are relatively healthy. But they're also sheep herders, and they're also spend, like 10, 20 miles a day walking around. And so they have a lot of exercise. Well, George Mann published this article in the journal Epidemiology, and it troubled him because it didn't fit with the science that he knew. So he went back and restudied the Maasai. Instead of us asking whether they had heart disease, he did autopsies on them and looked at their coronary arteries. And in every age group, they had worse arteries than the American counterpart. It's just the arteries got very dilated because of all their exercise. And the other habits that they had, prevented the plaques from rupturing. So you can find that diet and intimate air, ERA, in the New England Journal of Medicine, I believe it was 1978. Look it up. George Mann, diet, the end of an era. The Maasai are an interesting population of people. They're just an exception. There are a few exceptions. There's a whole article I wrote on Inuit Eskimos and why they survive. You should read it. You should look it up on my website about Inuits.
It's different doing it because you have to than because you want to. I mean, they don't have a choice very much, the Inuits.
Not the Inuits. No, they don't. And the Maasai, of course, I don't know what their motivation is. It's probably, deep in their culture. I don't know. But you can't use these examples to support a diet that contains large amounts of animal food. It just doesn't fit. You find out that the Inuit Eskimo average lifespan is 27 years. They have terrible, terrible atherosclerosis, as they did 500 years ago. They found bodies that were 500 years old encased in a tomb of ice, and they had horrible atherosclerosis. They had horrible osteoporosis too. All this is discussed, as I say, in a diet. You just go to our website, drmcdougall.com, look under the question and answer section, and you just put in Eskimo. I know that's not the proper terminology these days, but that's what science uses, and that's what history uses. It'd be the easiest way to find it. You'll enjoy the article. I had a lot of fun writing it. Now the people who live in Alaska and that part of the world that are Native Americans, they go fishing with a green lure. In other words, you drive through a fast food restaurant, you hold out a green lure and you get yourself a fish sandwich. And they ride around in SUVs and heated houses. And it's not like the tough old days when you had to sleep in an igloo and you had to hunt for your food and you used to burn 5,000, 6,000, 7,000 calories a day. With that kind of difficult life. You could not survive on the McDougall diet as a traditional Eskimo. It just wouldn't work. It's just too rough of an environment. So, this just shows you how adaptable the human being is. But it's not right. It's not right for the modern people in that part of the world. And it's not right for any of you who think you can justify your low carb, high meat, high protein diet. With the example of the Inuit Eskimos, they're relatively sick people. They were in the past. They were 500 years ago because of their diet that was, as you say, forced upon them.
We have a very nice comment that was written about you by Dina. I just saw it that Dr. McDougall's website and newsletters are an encyclopedia of nutritional knowledge, not just how to eat, but why. People appreciate your website.
I enjoyed. I wrote newsletters from 1986 to 2017 every month, and I enjoyed it. I used to spend 1 to 2 weeks every month doing it, and it made me a better person. I was forced to learn things, to think about things, to get to the bottom line. And, there's not a newsletter I need to change.
And you have them all memorized. I can ask you anything and you'll tell me the exact
because I work so hard. I have to work hard to get good results. I'm not one of those gifted people that just kind of pops out of their mouth and in their brain. I got to work hard. So I have to do a lot of research. I have to do a lot of thinking, before I can come to conclusions that I put down on paper that I knew I could live with 40, 50, 30 years later. And I have. There's nothing I have to retract that I've written that I can think of. Certainly nothing serious. And boy, oh boy, do I have a presentation for you that I would like to give.
I would love to give it. Just want to say that Daryl Woodruff's watching and says, Dr. McDougall is the pillar of health.
Dr. Woodward, you are so great. I have made so many friends over the years, and they've been through Mary's and my work. We just have endearing friends, and the Woodwards are those people too.
Yeah. You got a beautiful tree behind you.
Yeah. Mary's a real Christmas person. And so, one of the small things that I can do to make her really happy is to kill a Christmas tree.
That's funny. Well, it's beautiful. She did a great job decorating it.
So anyway, nice to be with you, AJ.
Always great to be with you. So we're going to talk about the breast today.
We're going to talk about breast cancer today is what we're going to talk about. And, let me just tell you, I've earned the right to talk to you about breast cancer. I've been studying this for almost my whole career, for 45 years at least. I published the first study on the dietary treatment of breast cancer. I did that in 1984. I had a couple of relatives who made a huge impression on me because they died of breast cancer when I was in my early 20s. My Aunt Margie died at age 53 of breast cancer. I watched her go through a mastectomy, then a bilateral mastectomy, radiation, chemotherapy, and nothing changed the course in a positive direction. She was miserable, bedridden. In fact, I have to say the treatments ruined her life. And then my brother, who's a physician, his wife developed breast cancer at age 28. They had 2 children. She died at age 32. My brother went bankrupt. Even though he was a physician, he went bankrupt. He had to live for the next year in my parents' basement with his 2 kids. I've been touched with tragedy of breast cancer, and I'd like to tell you what I believe I know is true, what you need to know about this disease, and what I think every doctor should be telling their patients about breast cancer. Let's see if we can get something up here. Oh, darn it! I'm sorry, AJ.
That's okay.
I got everything ready and then I goofed it up.
No worries.
All right, let's see what we can do here. All right.
Take your time.
Okay, there was. There we go. Okay. So, this is the conversation, and I'm going to do a series of these, AJ. I'm going to talk about osteoporosis and, all kinds of different topics, because I love seeing patients, and I don't have the luxury of sitting down with every woman who has a problem, or every man who has a problem. So I'd like to make a series of videos with you about what I would like to tell a patient who had breast cancer. And I think every doctor should be sharing this basic information with a patient so that she, in this case, breast cancer is 100 times more common in women than it is in men. She, in this case, can make informed decisions and avoid harmful treatments and unnecessary worry and unnecessary guilt. Tremendous amount of guilt associated around this disease. And there's a lot of emotion and a lot of lawsuits. The number one reason doctors are sued is failure to diagnose breast cancer. So your doctor's scared to death. Your doctor has the hesitancy to tell you what everybody else is saying, to get with the crowd, whether it's true or not. So what causes breast cancer? Well, probably environmental chemicals. Yeah, pollutants. I had a patient one time who's told me she had breast cancer. She says, my two sisters have breast cancer too, and we live downwind from a factory. Yeah, I think the initiator and subsequent promotion of breast cancer are these various chemicals. And some of them are involved with estrogen, and we're going to talk a lot about estrogen. Now, it's just not the chemicals spewing out in the air into the soil that your crops are growing in. It has to do a lot with what you decide to eat. These chemicals lie on your vegetable foods in low concentrations. As they move up the food chain, which is in your bottom left-hand corner, what you see is something called bioaccumulation happening. And the result is biomagnification of these chemicals. So maybe you start out with 1 part per million on the grasses and grains and seaweeds and so on. And as you move up the food chain, say to the cow or the pig or the fish, because these are fat-soluble chemicals, they get collected in body fat. What happens is you may increase the concentration 1,000-fold. And of course, the end of the food chain is that baby sucking off mother's breasts. And I've told you before that the Environmental Defense Fund did a study in 1978 where they looked at the breast milk of 1,400 women in 48 states and declared it a health hazard. The milk of Inuit Eskimos, by the way, the women, their breast milk is so toxic, it's been declared necessary to bury it in toxic waste dumps because of the environmental chemicals. This is a big deal. Okay, so, the chemicals are there, they're all around the world. The best way to avoid them, of course, is to stay away from pollutants the best you can see. And also to eat low on the food chain, eat potatoes and, rice and corn, not the animals. That's how you get into trouble. What you eat affects your hormone levels, and breast cancer is a hormone-dependent disease. Estrogen promotes breast cancer growth. Deprivation of estrogen causes women to live longer. And the effect of your diet causes your estrogen levels, and we talked about this last month, causes your estrogen levels to increase as you eat the high-fat American diet. In fact, they're 50% higher. Now, the consequence is overstimulation of your breasts, ovaries, uterus throughout your reproductive life. But you also start your reproductive life earlier. Little girls are supposed to be thinking about babies and families when they're 16, 17, 18 years old. They develop sexual characteristics or reproductive abilities when they're 8, 9, and 10 years old. Same thing with little boys, similar with little boys. And at the end of life, menopause comes later for those who eat a high-fat Western diet. And we know that early menarche and late menopause are associated with a dramatic risk in the chance of getting breast cancer and dying of breast cancer. So you want to focus on your estrogen levels. Some of those chemicals I showed you in the last slide are called estrogen disruptors, and they affect your hormones in tremendous ways. And anyway, there's a whole discussion of this, and this particular graph is out of a book that I published in 1985 called A Challenging Second Opinion, and you can get that book free from our website, as well as I think the McDougall Program for women we're now offering too, free. There's no gimmicks. Just go to the website, download it, and you can read it. I wrote that in 1985, and I don't have to remove or change a single word. Nor do I really have to update much. As we talked about, I got it right the first time, and the truth don't change. So it's very important that you understand the following mechanisms involved with breast cancer. It has to do with the growth of cancer cells. And for the rest of our discussion, you must understand this, because if you understand it, then everything I tell you will make sense. What happens is the breast tissue, and we could talk about prostate and tell the same story in men. The breast tissue gets damaged by these chemicals. Now, most of the damage is so severe that the cells die. But sometimes the cells aren't injured bad enough to die, but they're injured bad enough to become unneighborly. And they start doubling at their own free will. Now, cells are not allowed to double at their own free will, except under certain circumstances, or aren't allowed to double, period, except in certain circumstances, such as when a child grows, the cells are allowed to double. And if you injure yourself, the wounds, the cells proximal to the wounds are allowed to divide and close up the wound. Otherwise, the cells are not allowed to divide. But what happens is they get injured and they lose this tendency to have a normal growth pattern. They start dividing at their own free will, not like wildfire. It's been determined that the average doubling time for a cell, a cancer cell, is every 100 days. Okay, so you get the first cancer cell, and always one cell leads the way. A breast contains 100 billion cells per breast. A prostate, 100 billion cells also. So one cell out of 100 billion cells stops obeying the rules and starts dividing at its own free will. 3.5 months later, 100 days, it becomes 2 cells amongst 100 billion cells. The divisions continue, 8, 12. You've had a cancer for a year. And you have, somewhere around 12 cells lurking in a breast that contains 100 billion cells. You can't find it. And the divisions continue, doubling, 32, 64. You've had cancer for 2 years. You've got a mass that contains about 100 cells. Nobody could find that. There's no technology that could discover these cells. You could set loose a team of pathologists looking at your amputated breast. They would not be able to find these cells. All right, the divisions continue. And by the way, it's early in the disease that the cells break loose and go through the venous system and travel to other parts of the body. It's called metastasis. So they break loose from the tumor in the breast. They go to the liver, lungs, brain, bones, and they double at a similar time to the original cell. So here we are at 2 years. Let's take you up to there. We got 100 cells. The divisions continue, and finally you've had cancer for 6 years. You've got a tumor mass the size of a lead tip of a pencil, the size of a period on a paper. It consists of 1 million cells. It's not detectable by any technology available. And yet you've had cancer for 6 years, and if it's truly cancer, and a lot of what is diagnosed as cancer really isn't life-threatening. But let's just say it's truly cancer. Then before you can detect it, it has gone through 10 years of division. You've had cancer for 10 years. It's 1 billion cells. The tumor mass is the size of an eraser of a pencil. It's a centimeter in size. Then you can find it. Then you can feel it on a breast. Then you can detect it by a blood test for prostatic specific antigen. It's got to be a centimeter in size before it's detectable. Now, I want to point out something too. When it comes to tumors that are detected early, they're usually detected by women who examine their breasts, and we're going to talk about that. They're found by the woman herself. But slow-growing tumors are generally found by mammograms. On average, a tumor found by a mammogram has been dividing for 14 to 17 years. Okay, so what you understand is that before you even know that you're sick, the disease has already determined its course. It's already spread throughout the rest of the body. The cattle are already out of the barn before you shut the door. There's a very positive side to this message too, so just hold on with me. if you understand this mechanism, you understand why treatments don't work. And you understand why early detection is a misnomer. By the time a tumor is found, 2/3 of the course of the tumor has already occurred unbeknownst to the patient or the physician. You're just dealing with the last third of the disease. I published this many years ago in 1985. You see the chart I put together, and it shows the development of a tumor over a period of 13 years. You got to understand this. It takes a long time. It's not like wildfire. It may appear like wildfire to you because you're only looking at the last third of the disease. You're only looking at a tremendous amount of spread that occurred long before you or your physician were aware you were sick. All right, I'll assume you understand this, and I will move on to tell you, not all hope is lost. I told you I published the first study on the dietary treatment of breast cancer back in 1984. And that study is available for you to look at. It's somewhere on my website. It was many years later that the American Cancer Society finally came around to repeating my work and my conclusions. And they did so February 13th, 2015. The American Cancer Society now recommends that a part of the fundamental therapy of a person with cancer, including breast, prostate, colon, melanoma, is to change their diet toward the kind of diet that you and I believe is so important. This is law. This is the American Cancer Society. This is what every physician should be looking at. And what happens is you change the rate of doubling. I told you the average doubling time is every 100 days, every 3.5 months. Well, some tumors double every 23 days. That's not good. And other tumors double every, 800 days. That's good. I mean, my goal is to have every one of my breast cancer patients live as long and as high a quality life as possible. So, a woman destined to die in 3 years, maybe we could squeak 12 years out of her by not throwing gasoline on the fire, by not promoting the disease. And a woman who's destined, to live 12 years, maybe she'll appreciate her 107th birthday. I think that's real. You could change the course of this disease. You could change the doubling times. And if you wanted to get more details on this, you can go to my February 2015 newsletter. All right, let's talk mammograms and guilt. If you find out you have breast cancer, one of the first thoughts that comes to a woman's mind is, oh, I should have found it earlier. I just told you, early is 14 to 17 years after the cancer starts with mammography. But you feel guilty. You're sure it was your fault, and too often doctors do nothing to make you feel better. Let's talk about mammograms. You know what the procedure is. It's where they squeeze your breast, take some x-rays. It's a crude procedure, by the way. It was, when I was a medical student, it was first introduced by Wolf. I saw some of the first mammograms ever done, and we thought they were pretty crude then. They haven't changed much. They're still crude. And what they do is the jaws of this machine squeeze your breast, and about 1/3 of the women say they'll never have this done again. If you happen to have a positive finding on a mammogram and later on, you're told that it was a false positive, everything's okay. Half the women still worry about being sick 3 to 6 months after being reassured that they don't have cancer. It does a tremendous amount of destruction. How much good does it do? Well, let's take a look at the Cochrane Collaboration. Cochrane Collaboration is a supposedly unbiased group of scientists and interested citizens. They're in well over 100 countries around the world, 40,000 volunteers. And they write papers that help me as a doctor understand what the science says. I read a lot. I enjoy the scientific literature, but I don't have time to really read everything. And so they take experts in various fields, all the way from treating head lice to treating breast cancer, and they review the scientific literature and come to conclusions. That's the Cochrane Collaboration, and they publish papers in the Cochrane Library. You can you can believe these papers. Almost all of them I agree with. The head of the Cochrane Collaboration was Peter Gertzke. He's a friend of mine. And he served for 23 years as the head of the Cochrane Collaboration. He published a book called Mammography, Screening, Truth, Lies, and Controversies. You can get this book on Amazon. I encourage you to get it if you need to convince a knowledgeable friend, physician, etc., about your position on mammograms. As far as a good read, it's not a good read. I mean, I asked Peter one time if he wrote his own books, and he said, yeah. And I should have told him, well, I can believe it. Because, they're really, really technical, really difficult to get through. But, I lived this research. So to me, it was very interesting and very relevant. So you might want to get this book. A doctor insists that you have a mammogram. You say, read this, and then you tell me I need a mammogram. Anyway, the conclusion of the Cochrane Collaboration is routine mammograms, every couple of years, do not save lives. And they increase the number of women overdiagnosed. Overdiagnosed is a big problem. And they increase the number of women who are having mastectomies. After all, if you go look for a problem, you find it, and of course you have to treat it then, right? Well, they put out a brochure in 2012 that was in 13 different languages, which told women not to have mammograms. And this is what the Cochrane review says. It says that if 2,000 women are screened regularly for 10 years, one will benefit from not dying. 1 out of 2,000. And of course, if you're that 1 out of 2,000, you go, whoa, it's worth it. But we got to talk about everybody who goes through this. At the same time, 10 and as many as 50 healthy women become cancer patients and will be treated unnecessarily. They're overdiagnosed. They would have never died of their cancer. It was either too slow growing or a false diagnosis. So you have made 10 to 50 women breast cancer victims. And no longer do they say, hi, Marge. They look at you, oh, breast cancer. What you doing today, Marge? You can't get health insurance. You can't get life insurance. You live under this cloud of thinking you're going to die. Oh, and if I'd only gotten the mammogram earlier, I'd have been okay, right? Guilt. And if you do 2,000 mammograms, somewhere between 200 and 600 women will be required to go through further testing and treatment. Yeah. And their conclusion is it's therefore no longer seems reasonable to attend for breast cancer screening. Okay, does your doctor know this? No, your doctor doesn't know this. Let me explain this to you. Of course, when I say this, you know that I'm generalizing. There's some doctors who are well informed and really stand by their patients, but most of my colleagues are practicing medicine based upon incorrect information, and they don't take the trouble to find out what the correct information is. Let's take a look at a study that was published, and there are 2 studies that were done. The other one's showing the same thing. They wanted to find out what the physician's knowledge was concerning mammograms. What do they think about them? And so they went and looked. They went and talked to general doctors, family practice doctors, internists, et cetera. And they asked them, what do you think the benefit of a mammogram is? And they said, improve survival. Okay, they said, you'll live longer from the time of diagnosis, improve survival. And they also said, you'll find more breast cancers, and that's good for a patient. But the truth is that few of the doctors recognized that only randomized controlled trials showing an improvement in survival for the screen group is evidence that it works. Let me go through this in a little detail with you. Okay, finding the tumor early. Here's the day of death. It's listed there as a 0. If you're not doing screening and you just casually do examinations, you may find the tumor when it's a little larger, say 3 years before diagnosis. If you're going through extensive breast examinations, checking your breasts every hour, every day, doing mammograms, et cetera, and you find it, say, 7 years before you died. Yes, you lived longer from the day of diagnosis, but you didn't live any longer, period. You just lived longer knowing you were sick. You just lived longer knowing that, being a customer of the medical business. You died the same day. Early detection just finds the tumors earlier. But that's true because of the mechanism I just explained to you. By the time a tumor is found, it's 10 years old. Or by mammogram, it's 14 to 17 years it's been growing. Okay, so early detection is a fallacy. It just means you found the disease earlier, that's all. Oh, and by the way, they used to say that if you lived 5 years, you were cured. Well, you can see what nonsense that particular message is. The other thing that doctors said is you find more tumors, that's good. You increase detection. Well, if you look for tumors while you're still alive and you find a whole bunch of tumors, and what happens is you take these tumors out, and that's all interesting. But if you compare the tumors of a woman who didn't go through this type of examination, in other words, she didn't do early detection, she didn't have a whole bunch of biopsies done, and you add the tumors up, you find out that they're the same number of tumors in a woman who didn't have early detection, and those women who found tumors earlier, in other words, they found tumors while the patient was alive. Doesn't change the day of death. As they said in this, the only way that you can really establish whether or not these early detection techniques work, and I'll tell you, as far as I know, and I'm pretty up to date on this, there are no early detection methods that result in improvement in survival. Okay? So here you take let's just test mammography breast cancer. Here you take a large number of women, you divide them into two groups. One you do a whole bunch of mammograms on, the other you don't. The ones you do the screening on, you ought to, at the end of period of time study, you ought to be finding more women alive, and you don't. These are called randomized clinical trials. And they all show the same thing. Early detection for all the cancers I'm aware of does not improve survival. Well, there are a couple of minor exceptions, but certainly all large tumors. Breast self-examination is harmful. Don't do it. That's me talking to you. No, that's not me talking to you. That's the Canadian Task Force on Preventative Health Care. In 2001, they told Canadian citizens, don't touch your breasts. The American Cancer Society finally came around with the U.S. Preventative Services Task Force statements. And they said they shouldn't be teaching, doctors should not be teaching women to do breast self-examinations. Why? Well, because you find problems. And the result is you go for tests and treatments that hurt you right there, but found evidence of increased harm from benign biopsies. You better be sure that you're looking for something that you can change, you can make a difference in, and you can't. And if you understand the natural history of cancer, of breast cancer, then you understand why this has to be so. So how do you find a suspicious mass? How about when you take a shower? I mean, that could be once a week or once a month. That's good enough. How about when you take a shower? Rather than fixating your whole life on checking your breasts and being afraid and having guilt, which is what happens with women. They feel this obligation to make sure that they catch it early enough, and they can't. So what are you looking for? Well, cancers, they're usually hard and irregular, and they're fixated to surrounding tissues. A lump, like a fibrocyst or a fibroadenoma, they're usually smooth and easy to move and sometimes painful. But you only make the diagnosis of cancer under the microscope by an experienced pathologist. So that's the amount of effort you should be put into early detection. When you take a shower, Don't ruin your life over it. All right. So if you find a lump and say it's cancer, and again, this is discussed in the book. It's available for you for free, no gimmicks, along with the McDougall Program for Women. I believe Heather put that up. Written in 1985. Good grief. Well, the truth don't change. Anyway, you can have a biopsy. You can have a lumpectomy. You can have a segmental mastectomy. We're increasing the amount of good tissue that's taken. You can have a simple mastectomy, removal of the entire breast. But when I first started practicing medicine back in the early 70s, 1980s, the standard treatment was a radical mastectomy. They took the breast, the lymph nodes on the affected side, and the muscles on the chest wall, mutilating. Destroyed women's personal appearance and their lives. Anyway. So the difference being a lumpectomy, you just take the lump out, all right? And it can be relatively non-deforming. It's important that you get clear margins. And that can be determined at the time of surgery. The doctor makes sure that he or she got all the tumor and there wasn't residual left in the breast. Not that it will reduce your chances or increase your chances of dying if it leaves a little bit of extra tumor in the breast. It just becomes another problem we'll talk about in a second. So you do a lumpectomy, and the argument is that if you just do a lumpectomy, that you'll have an increased risk of local recurrence. Well, not if you do a lumpectomy with clear margins, you don't. And so without the criterion that you have clear margins. I mean, just looking at random lumpectomies, the chance of the tumor recurring in the breast is about 30 to 40%. The chance of it recurring on the chest wall after a mastectomy is about 10%. And if you add radiation, the chance of the tumor occurring on the chest wall is again about 10%. Okay. What we're talking about is local disease, controlling local disease. And if you remember the discussion we had at the beginning of this, you realize that we're not dealing with just local disease. We're dealing with systemic disease. In other words, disease that's spread throughout the rest of the body. A mastectomy, they take the tumor, the breast, as I told you, are radical. They take the muscles underneath and the lymph nodes. All right. Bernard Fisher, one of my heroes. He did the most important studies on breast cancer that have ever done or ever will be done. They did a study back in the 1970s, finished in the 1980s, on comparisons of various kinds of surgical treatments. And I want you to notice that the things that they looked at were total mastectomy, lumpectomy, and lumpectomy plus radiation. Please take a look at this in the bottom left-hand corner. And what you see is there's no difference in survival among the treatment groups. Do you see that? We've known that for 45 years. Okay, so let's go over this one more time. The chances of surviving are the same if you have the entire breast removed, including the muscles and the lymph nodes, compared to just taking the lump out, no radiation. We're not talking about any radiation added, and taking the lump out and adding radiation. All right, the effective radiation after mastectomy and axillary surgery, 10-year recurrence and 20-year breast cancer mortality. After 20 years, radiotherapy was not associated with improved overall survival. If you want to read, the various studies, if you go to my September 2017 newsletter, there's a thorough discussion about the effects of radiotherapy. And again, if you recall the natural history I gave you of this disease, why would radiating the chest wall cause you to live longer? The tumor is already in every part of the body. Doesn't make sense. Why would more extensive surgery make a difference? And when you die, it makes no sense if you understand the natural history. you don't want to leave a breast cancer untreated. I've seen about 8 women in my career who have decided not to have the tumor removed. And I have evidence that says they would live longer than women who had the tumor removed. It certainly doesn't shorten your lifespan by leaving the tumor. It's just an ugly mess. You know, it's like taking care of a piece of hamburger on your chest wall. Why put a woman through that? So you need to control local disease. And that's why I recommend a lumpectomy with margins free of cancer cells. That's my treatment of choice. It's been my treatment of choice for half a century. It used to be the treatment of choice at Cleveland Clinic. Barney Cryle used to be a strong advocate of just doing lumpectomies. So you want to make sure that you don't have this kind of an outcome. And not that it'll affect the day you die, but it'll affect your life significantly. And radiation can be delivered, or more surgery can be had if the tumor comes back, and you get the same results as far as how long you're going to live. You know, in other words, the radiotherapists and surgeons are really good at controlling local disease. So why treat, even if it was 30% of women got recurrences in their breasts who had a lumpectomy, why treat 100% of women with these aggressive therapies when only 30% would need it? 60% didn't. Save the arrow in the quiver for those who need it. All right. Chances of living longer. I'll tell you what affects your length of survival. The things that suppress the immune system, major surgery. You know, big surgery will suppress your immune system. Blood transfusions, as a matter of fact, when doctors started first dealing with kidney transplants, what they discovered is those patients who had blood transfusions at the time of the kidney transplant, it suppressed their immune system. And they retained the kidneys longer. So blood transfusions, radiation, chemotherapy, lymph node irradiation, lymph node removal. These things should not be done routinely. No scientific reason to do it. Again, I just recommend a lumpectomy with clear margins. All right, how about toxic chemo regimes and estrogen suppression? Remember, this is a systemic disease. It's throughout the entire body, which, by the way, you're going to control by being a healthy person. You're going to end up living a long time. This is not gloom and doom, but you need to know so you can take proper actions. You don't want to do things that harm you just for the sake of doing things. More aggressive is not better. So doctors realized this. They realized that they were back in the late 70s. In fact, they realized it in 1951. They realized that they were dealing with a disease that had already spread throughout the rest of the body, and no local therapy would ever help as far as improving overall survival. And so we developed ways of going out and getting the cells that had spread throughout the rest of the body. And that being cancer chemotherapies, toxic cancer chemotherapies, and also estrogen suppression regimes. Okay, you can reduce overall mortality by reducing estrogens. Remember, estrogen promotes the growth of breast cancer and increases your risk of dying. Anything you could do to block the estrogens is going to make a difference in your chances of survival. You could take pills like tamoxifen or aromatase inhibitors. And by the way, I discovered a whole bunch of natural supplements that are aromatase inhibitors. And there's evidence that these work too. I never used them, but I thought I'd bring it to your attention. So these suppress the activity of estrogen on your cells. That's one way to do it. The side effects of these are you have an increased risk of uterine cancer because not only do they have an anti-estrogen effect, tamoxifen in particular, but they have an estrogen stimulating effect. So you have an increased risk of uterine cancer. You also have an increased risk of osteoporosis by taking these pills. And you go through menopause. So, the hot flashes start early. There are other ways to reduce estrogen stimulation of the body and the cancer cells. And what I recommend is removal of the ovaries through a simple laparoscopy procedure. Now, I know for a lot of women, they don't want to do that and they were going to take the pills. And I think that's okay. I think it's worth your while to do. I recommend it. But if you want to get on with your life, because you're going to live a long time, that's the thing you got to start thinking is, I'm going to live a long time. And so these decisions I'm making now are going to affect me for decades. That's why you got to slow down. You can't be rushed. You've got to learn. You've got to understand what's going on so you can make the right decisions. Now, the other way that you can knock out the ovaries is by cancer chemotherapy. Cancer chemotherapy, that's how it works. Yeah, the more common cancer chemotherapies, they cause chemical castration. At a price, not just a financial price, but a woman loses her hair and throws up for a year. That's cruel. Let's take a look at a review of polychemotherapy on randomized trials. And these trials show you just what I explained to you. There is a 10-year survival improvement of 7 to 11% for women under 50 who have ovary function. In other words, you deprive them of estrogens by the chemotherapy. But women who are postmenopausal, in other words, their ovaries have already shut down, you only have a 2 to 3% improvement in survival. And by the way, ladies and gentlemen, you're gonna, if you get involved in the medical business, you're gonna be fooled by a whole bunch of terminology. They talk about disease-free survival. Well, you know what? If you suppress the disease, you won't see it. So you have disease-free survival. The only thing you're interested in is overall mortality. Don't put any other card. You just care about, okay, I'm going to choose this therapy over not choosing it or another therapy. How long will I live? It's the only card on the table. And so you want randomized controlled trials that look at overall survival. Nothing to brag about when it comes to toxic chemotherapy. All it does is cause chemical castration. Again, there's a much more humane way to castrate a woman. So you end up depriving the body of estrogens through various mechanisms. Now you're dealing with the fact that the bones, strength of the bones is determined by estrogens. And when you deprive the body of estrogens, you increase the risk of getting osteoporosis. So what do? Well, the basic things that you do are eat a low protein diet, because high protein causes the body to lose its bones, causes osteoporosis, particularly animal foods. And I'm talking about, beef and fish and cheese. In fact, cheese is the most acidic of all foods that we eat. So you eat this acid food and the bones dissolve to release alkaline material to neutralize the acid so you don't die from all this acid you eat. And the bone material ends up in the kidney system where it forms kidney stones. And you essentially pee your bones into the toilet. So to preserve your bones, what you need to do is a low protein diet, and sweet potatoes would be a great food to eat. Sunshine, very important for the health of the bones. You need to have sunshine. It's absolutely crucial. And then exercise. These are first-line therapies. Now, to preserve bone health, there are second-line therapies that I'd like you to consider. One is to take an antacid to neutralize the dietary acids you consumed in the form of beef and chicken and fish and cheese. If you take an antacid, any kind of antacid, it doesn't have to be Tums, that's calcium carbonate. It can be sodium bicarbonate. It can be potassium hydroxide. It doesn't make any difference. It's just an antacid. It neutralizes your metabolic and dietary acids at not much of a price. A couple of wafers a day, 1,000 milligrams a day. That's what you do. Now, these are only, I make these recommendations only for women who have a high risk of osteoporosis. And this would be perfectly fine for a woman who had deprivation of estrogens caused by the various things that we talked about a couple of slides ago. Progesterone cream is supposed to be, progesterone is anti-estrogen. And there's evidence that progesterone cream causes the bones to strengthen. I don't know that it's that good of an evidence, but I don't think it does any harm. And you can buy estrogen creams over the counter in your natural food store, or it can be prescribed by your doctor. Now, if you didn't have breast cancer, I would prescribe estrogen as a skin cream. And that's discussed in the book, The McDougall Program for Women, which again is offered to you for free on our website. So I prescribe skin creams that contain estrogen and progesterone. That's the way that I deal with women who are high risk of fractures. You know, not the average person who flunks a bone mineral density test. You know, somebody who's already had some fractures due to non-traumatic events. Then I go to the next regime, like antacids and estrogens and progesterones, but not estrogens when you're dealing with breast cancer. Remember, estrogen promotes cancer. So, you know, the facts are the facts. They haven't changed in 50 years, probably 70 years. But we're still practicing archaic medicine, inhumane medicine. Of course, what do you expect from a male-dominated medical business taking care of women? When a woman buys into the message from, you know, the standard American Cancer Society, well, they're improving. Standard recommendations out there. What does she get? You know, maybe let's just give her a few extra days of life. But what does she have to do for that? She has to have annual mammograms, or maybe every 2 years. She has to do breast self-examinations. You know, maybe even daily, certainly every week. Women are frightened into doing them. She has to go into a male doctor's office, and you know, I know there are many female doctors out there, but you know, it's usually been a male doctor's office, and take off her shirt and expose herself and let the doctor examine her. She's willing to do that for maybe a few extra days of life. She's willing to undergo biopsies, mastectomies, radiation, ovary removal, anti-estrogen drugs, and polychemotherapy. But what I hear from my colleagues and many other people is it's too much to ask them to change their diet when that's the thing that works. Ladies and gentlemen, it's the food. You know, if you want to have a good life, a long life, even when things are so desperate, I have women in my practice. The scientific literature talks about women who've had cancer spread throughout their entire body who have recovered. They've had spontaneous remissions. Don't ever give up. And the kind of diet you need to eat is the diet that is associated with the lowest chance of getting breast cancer, the lowest chance of having these poisonous chemicals in the food, the best chance of having a healthy immune system. That's a starch-based diet with the addition of fruits and vegetables. And we've been teaching that for, well, since 1977. Still teaching it today. I hope that my presentation was understandable. If not, you can read the books or you can watch the show again. But this is what I always wanted to tell you if you were my patient for breast cancer. Yeah, I want to sit down and look you right in the eye and say, this is the truth. You know, once you know the truth, then you can go out and you can make decisions. You're going to get a lot of different messages. But I would ask you to challenge your doctor. Say, hey, what about this point of view? What about this research? I've showed you the scientific studies. You know, question these people. You know, when you buy a car, you question the car salesman, don't you? You know, you're buying a type of product that will change your life. You need to ask questions, and please don't rush. This is a 10-year-old disease by the time you find it. You got days, weeks, months to understand what the truth is. And I put that all together for you in 2 books, McDougall's Medicine, A Challenging Second Opinion, and the McDougall Program for Women, which, you know, we'd like you to have. Not only we'd like you to have, we'd like to give it all your friends and relatives and your doctors and your dietitians. It's free, no gimmicks. And I've written a couple of newsletters, and the most important one is September 2017 newsletter, which talks about the fact that the treatment for breast cancer is barbaric, brutal and barbaric, but it exists. And you know what? I don't know if it's getting any better. All right, AJ.
That was fantastic, Dr. McDougall. When you said you published research in 1984, you actually did the study at your clinic?
I did the study when I was in Honolulu. When I was in Honolulu, I had a radio show and I recruited women with breast cancer. Ruth Heydrich was one of them. Do you know Ruth?
Yeah, she's been on the show.
Yeah, right. Well, Ruth has an interesting story. Anyway, I recruited these women with breast cancer and I changed their diet and I changed the prognostic factors as far as their chances of survival. Overweight women die quicker. Women with high estrogen levels die quicker. High prolactin levels die quicker. Higher cholesterol levels, they die quicker. Why? Because it all reflects their eating patterns. Anyway, I met Ruth Heydrich back in probably 1987. No, I had to meet her before that, but she came to my office. That was 1977. Yeah, she came to my office and she says, I got good news and bad news. The good news is I got rid of a bad husband after 12 years. The bad news is I've got cancer every place. And I said, Ruth, I said, I really don't know what to do, but I've been reading a whole bunch of stuff that I thought I'd make available for you. And she sat in my office for 2 days and she went through the papers that I'd pulled from the scientific literature that showed showed the things I just told you. This is old information. It's been around forever. Your doctor should know it. Anyway, Ruth had metastatic cancer all over her body. In fact, I just talked to Ruth the day before yesterday. And she's doing well. She's in her mid-80s. And she's won 1,000 triathlons and marathons since we met. Anyway, she's one example. And I have many, many examples of patients that have done extremely well. But the most important thing is that you do no harm. Food does no harm. It costs nothing. You should do it for all kinds of reasons, including a good bowel movement. Recommending these therapies that mutilate you and make you sick. You got to be careful. You got to make sure that the good outweighs the bad. And I'm here to tell you, the scientific data questions this, even though that's the usual doctrine out there to get all these kinds of therapies I talked to you about. This is routine. Don't you dare question it. This is routine. Well, it's wrong. I've known it's been wrong. I've written about it being wrong. And you can find out whether I'm right or wrong by simply reading the things that I've written. And I've heavily referenced my writing with scientific research. You can go read the original papers. I really don't know. When I get into a discussion with my colleagues, say an oncologist, I've had many discussions with oncologists, particularly when I was in Hawaii. I'd sit down with these experts, like the head of the Hawaii Cancer Society. And 10 minutes into our conversation, he'd say to me, you know as much about this disease as I do. I'd say, of course I do. Why do you think I agreed to talk to you? You can know as much as your doctor does. And really, I need to take the trouble. This is your life. I've made the science available to you in such an easy format, easy to understand. If you don't take the trouble to read a couple chapters in the books that I've written, which I've given you for free, and read the newsletters, which you can have for free, you're not trying. Somebody's really caused you to give up. Don't give up. You have a life to live. You have a good life to live, and it depends upon the choices you make. I'm here to tell you that the right choice is fix the food.
Yeah. Dr. McDougall, there's a lot of questions, so I don't know if you only want to take ones on the topic.
I'd love to, I really hope I stimulated you to learn, to understand the things I've understood for 45 years and been so frustrated to see people hurt unnecessarily for money. So yeah, I'd love to answer your question. I want to make sure that I was clear. I want to make sure that you understand why early detection doesn't work. It's late detection. I want you to understand why aggressive treatment of the local disease, in other words, what's on the chest wall, doesn't make any difference in survival. I want you to understand systemic therapy. Yes, you need systemic therapy. And by the way, there are some isolated types of cancer out there that are subtyped which may respond better to chemotherapy than the general regime of chemotherapy that's given to almost all patients. There are several other regimes out there that you want to look at. You go to the doctor, you say, okay, doctor, this is what you recommend. Tell me the protocol. Give me the scientific data that supports your point of view. And then you go home and you get on the computer and you go to the National Library of Medicine or just Google and put in the studies that the doctor suggested that you read to support his or her therapy. Usually these studies will tell you the other point of view, and start doing some research. Always look for overall survival, not disease-free survival. Overall survival. Yes, you may have less chance of dying of breast cancer, but you're going to die from the surgery and the chemotherapy and all the other things. And the end result is you have the same risk of dying. So you always have to look for overall survival. You want to look for randomized controlled trials. You need to do this. I mean, what's more important than you, your spouse, your child, your mother? Take the trouble. It won't take you long to become an expert. I bet in a week, most of you can walk into your doctor's office and the doctor will say to you, you know as much about this disease as I do. You go, of course, doctor, I got it. Well, why wouldn't I know most about it? So let's have some questions.
It's unfortunate because like you said, by the time it's detected, it's been in the body for 10 years or more. And even when people change their diet, they get frustrated that, well, I changed my diet and I still got cancer.
Well, it's because it started 7 years before when they were eating at Burger King, or 10 years before. There's good evidence that the initiation of breast cancer occurs during adolescence. So it occurred a long time ago. But the thing is that the body is always trying to heal. If you look at breast cancer specimens, you'll find immune cells attacking the tumor. The body never stops trying to heal. It always wants to survive. That's a basic rule. And if you take the attitude that your body is incapable of staying alive, you're finished. If you take the attitude that the only way you're going to beat this is from outside help, you're finished. So, there are people who say that everybody has cancer cells in their body. Well, everybody doesn't die of cancer. If you look at the breasts of women in their 40s, random tests of women in their 40s, you find various stages of breast cancer in essentially all women. That reference, by the way, is in the book, McDougall's Medicine, A Challenge and Second Opinion. You find all the way from early transitions to frank cancer in essentially 100% of women. Certainly, you always find it in the other breast. This is another dichotomy of worry that's always troubled me. Is when you have a breast cancer, say in your right or left breast, the doctor just takes off one breast. This is a disease of all breast tissue. Why not do bilateral mastectomies routinely? Because nobody would come to your doorstep, doctor. They recognize that as aggressive and brutal. But you can get away with taking one breast. Help yourself. Anyway, so what I'm saying is, hey, we've done a lot of things unhealthy to us, and diet's not going to fix everything, but it's going to make the major difference as far as your health goes in your future. And costs nothing, no side effects, gives you a good poop, makes your breath smell better, takes care of your oily skin, makes you a better lover.
Is there something particularly deleterious in the standard American diet that is causing the cancer? Is it the dairy? Is it alcohol? Is it all of the above?
I think that, I told you how you get these chemicals in your body, the chemicals that come from industrial pollutants. And I showed you how when you eat high on the food chain, you get very high concentrations of these chemicals. So I think they're the initiators and also they're promoters of cancer. The other thing is estrogen promotes cancer. And so once you get the cancer, what happens is if you have high estrogen levels, which you'll have if you eat the high-fat American diet, 50% greater estrogen levels than women who eat like we do, then you're going to promote the cancer. You're going to hurry up your day of death. Oh, that's what it is. It's not heredity. You might have a hereditary tendency, but it's not hereditary. Post World War II, there was no breast cancer in Japan. I've actually been in touch with several years ago, breast cancer survivors group in Japan, and they use a lot of my material. And these women are old enough to remember post World War II. There was no breast cancer. Now, of course, it's becoming quite common because the adoption of the Western diet. So women who have no ovary function, for various reasons, either were born without ovaries or they were removed when they were very young, they don't ever get breast cancer. This is an estrogen-dependent disease, and we talked about last time about various mechanisms that the food causes the estrogens to go up. They shoot the cows and pigs, chickens with hormones, and that's one way. And then you grow bacteria in your colon that convert food substances into estrogens, and the fiber and the plant parts they block the activity of estrogens. Being overweight, you have more estrogen. The fat cells in your body actually convert male hormones that are produced in the adrenal glands into estrone. So the fatter you are, the more overweight you are, the quicker you'll die, the more likely you'll get breast cancer. So I wouldn't want you to focus just on that. It goes one step back. You must look at the common denominator. It's the food. The food makes you overweight. Food raises your estrogen levels. The food raises your prolactin levels. The food raises your cholesterol. It spoils your immune system. It's the food. You can lose weight on the Atkins diet, and you'll end up, as far as I understand, you'll end up dying quicker of breast cancer. You'll be thin, but you'll shorten your life. I can say that. My February 2015 newsletter says it, based upon the American Cancer Society's findings and conclusions, is that if you eat this kind of low carb, high protein, high fat diet as recommended by too many people these days, that you're going to be harmed. And by the way, if you go to that February 2015 newsletter, you'll click on various studies showing that if you eat well, you'll live longer. The evidence is overwhelming, but it doesn't create any money. So no reason to tell you. It's doesn't fit into the profit scheme, ladies and gentlemen.
Why do they tell women with breast cancer not to drink alcohol? I mean, I don't think anybody should drink alcohol, but why is there a connection there? Well,
alcohol suppresses the immune system. Alcohol makes it more likely for you to be overweight. I don't know of any real toxic effect of alcohol. I mean, there's a lot of toxic effects. It's a very dangerous drug. But alcohol does not make you overweight itself. The alcohol molecule is not turned into a fat molecule with any efficiency at all. But what alcohol does is it relieves your inhibitions. So instead of one potato chip, you have 3 bags of potato chips. That's how alcohol hurts a lot of people. Is you just stop sensible behavior. Yeah. And by the way, well, we're talking about alcohol. We're talking about people falling down and bumping themselves. One of the things that many women believed is that you get breast cancer by injury to the breast, by, say, somebody bumping your breast. That's not how you get breast cancer. You also ought to know that these prophylactic mastectomies, where they take off your breasts early in life, you still can get breast cancer because they can't get all the breast tissue. And BRCA, the BRCA gene issues, BRCA1 and BRCA2, which are women who have very aggressive ovary and breast cancer, what they find is that removing the breast does not prolong survival, but removing the ovaries does. Why? Because you reduce the estrogen stimulation. So, as far as I'm concerned, a woman with the BRCA gene, she should have the lump removed. In other words, non-deforming surgery, and she should have her ovaries taken out.
Great. Thanks, Dr. McDougall. Here's a question that was sent in from Bonnie. Could you please ask Dr. McDougall his thoughts on tamoxifen? I had a lumpectomy and radiation, no chemo. My cancer was estrogen positive. I've just started taking it, but I hate being on it for 5 years.
Right. Well, I routinely offer tamoxifen or aromatase inhibitors to women as part of their therapy. The Susan B. Komen website has a really good section on what the benefits will be from taking tamoxifen for 5 years. And they're not a lot, but it is some improvement in survival. So I think you should consider it. I think rather than taking the pills, which cause hot flashes sometimes and increased uterine cancer and osteoporosis, maybe you think about having a simple laparoscopy removal of the ovaries. Most of the women we're talking about are past the reproductive years. Not all. My sister-in-law wasn't. But, most women, they don't get it until they get older.
Great, thanks. And somebody named Lynn's asking about hydroxychloroquine.
What about that's the drug to treat COVID, right?
Okay. So maybe it wasn't related to breast.
This gets into a whole nother subject. No, I do not recommend hydroxychloroquine. No. I'm just a regular old country doctor. I don't do that.
Right. Okay. So let's see. Now, do the questions that were sent in, do you want them only on breast cancer? Because they have them on a few other subjects.
Let's start with the breast cancer if we could.
I'm going through them right now. But there's lots of questions. They're just not all on breast cancer. And my chat goes very, very fast.
We'll get Mary in here and I'll answer the general questions for you whenever you want.
Absolutely. Yeah.
It's essential that you understand the natural history of this disease. Then everything makes sense. You know what to do. You slow the doubling times. If it's truly cancer, you've already got a systemic disease. A lot of what's diagnosed as cancer really isn't cancer. It just kind of looks like cancer, but it doesn't act like cancer. So that's where you overdiagnose. And of course, you live with the stigma of having cancer. Once you have this kind of investigation done, you're thought of as a cancer victim from that day on. You'd never died of it. It would never have killed you. You died something else first. Overdiagnosis, and that happens a lot. Well, anyway, it happens a lot.
I found a cancer question from Pat. I did not submit a biopsy after mass was found in the right breast 10 years ago at 59. When I asked about the last mammogram 25 years ago, my doc said it was present but small. I was never told. 30 years later, I'm reluctant to go for a biopsy. Both my breasts look uniform with the right a little smaller. I'm vegan 15 years, SOS free about 2. I have 20 pounds to lose. I'm 39% body fat. Is it possible that I can save myself without biopsy and possible surgery?
Well, if you have a lump, I told you ought to remove it because you don't want to have it grow through the skin. You don't want to have this mess on your chest wall. So if you think that it's a suspicious lump, in other words, it's growing, it's hard, it's fixed, have it treated so the local disease is not a big deal. You've got to separate local disease from systemic disease so you know what to treat and how to treat it. You want to control local disease. That's your goal. And the way to do it most simply is to do a lumpectomy with clear margins. If you don't have that luxury, then you didn't get clear margins or whatever, you have the option of not doing any further treatment until it comes back. And if it comes back, then have further surgery or radiation at that time. There's no loss of life by delaying the treatment of localized disease. It's a 10-year-old systemic disease. It should make a lot of sense to you. As I say, I used to have evidence before it caught fire. I used to have evidence that talked about women who had untreated breast cancer and how their survivals were really good. It's a tough life. As I say, I sat in my office and I watched about 8 women walk through my office, showing pictures like I showed you of untreated breast cancer. It was tough, but that was their choice. They didn't want to have the therapy, and they were told, of course, that they will die sooner and that it's stupid and they had caused a lot of guilt, and they're not true. But they suffered by having untreated breast cancer in their own way. But decreasing the survival is not one of the consequences of untreated breast cancer. I know this is really upsetting you, but it's true. And I've told you why. and the evidence is there. If treating breast cancer worked, you'd see it in the scientific studies. I showed you Bernard Fisher's work, but no work done after that of any importance. He just settled it in the late 70s, early 80s. I showed you the results of treating the breast with radiation and many other studies in my September 2017 newsletter. The truth is there. It's not going to change. If we were having wonderful success, we'd be hailing from the rooftops how we're curing all this cancer. We're not. But you can prevent it. But if you get it, you can only take treatments that do you more good than harm. And you can fix the problem, which is the food. And do a few other estrogen depriving things and treat local disease. And it's really simple. The truth is simple. The truth is simple and easy to explain. I hope I explained it all to you. If not, I'll keep trying. But it's very clear in the books that I've written. So go to the website and get those books. It's all there, all the research, all the references. I'll tell you, if you can get your doctor to sit down and read what I've written, and you should insist on it. Tell your doctor, I'll pay you $200 to read this book on my disease. That's cheap. Tell me why he's wrong. Tell me one word he said that's wrong. Show me a T he didn't cross, a sentence he didn't end with a period. You tell me. I was really fanatic. I was OCD when it came to writing these books because I knew they would stand the test of time. And I knew if I did it right the first time, I wouldn't have to apologize or change later on. These are things that have been known for a long time. Breast cancer has been treated surgically for probably 500 years. At the turn of the 19th to 20th century, the typical treatment for, not typical, a commonly practiced treatment for breast cancer was to remove the breast, the underlying muscles, and the arm on the affected side. And then we have Halsted, who came along in the 1920s, who popularized the radical mastectomy. By 1951, we knew that it didn't improve survival. Fisher proved it, as I showed you. Local treatment does not cause you to live longer. Why? Because it's a systemic disease. Plan on it. Live that way. This is not all sad. What's sad is to have you miss out on life. Telling you the truth, actionable truth, is not sad. It should empower you. It's cheap too. Costs you nothing.
Lori says, I'm curious as to how many women die from complications of the treatment versus the cancer itself. Thank you for sharing today, Dr. McDougall.
Equal. In other words, if you look at the lives saved, and Cochrane said 1 in 2,000 women had their life saved, then 1 in 2,000 women would be killed by chemotherapy or the viral infections that follow it, or on the operating table, or the anesthesia associated with the operation. So, there's no reduction in mortality. Even though you may have a less chance of dying of breast cancer, they'll kill you some other way. How often do women get breast cancer? 1 in 7 women get breast cancer. How often do they die of it? Oh, much less. They live longer. If you really have breast cancer, what's the chance of you dying of breast cancer? And this is in the books. You can read it. You can read the research. Women back in the 50s and 40s and so on, when breast cancer really presented as a serious disease, not just a biopsy. The chances of dying of breast cancer were somewhere between 78 and 100% of eventually dying of the disease. So that's the long-term natural history. You can change that. I've told you can change that. I published that in 1984 in the journal Breast. The American Cancer Society published it in February 13th, 2015. You can change the course of this disease by not throwing gasoline on the fire. Makes all the sense.
Yep. Okay, so I'm waiting for a question that somebody has just emailed us. Here it is. So this is from I can't pronounce the first name. I am at high risk and I'm only 45. I have so much fear that I'm taking necessary treatments currently on Nerlinks. Will diet prevent this from metastasizing? It's so hard to believe when the doctors are constantly scaring you, but I want to be realistic.
Fear and guilt. They're after you. I don't know what that particular treatment is, so I'd hate to comment on it. The food fixes you so that you are a prime fighter for anything that would reduce your risk of surviving. The body wants to survive. It's natural. It's always healing, always. There was a study published in 2011 in Lancet Oncology, where they took a large group of women and they divided them into two groups based upon their frequency of having mammograms done. And they followed them for 6 years. So they took one group that had a mammogram done initially and no more mammograms. And they took another group which had a mammogram done every 2 years for the 6-year period of time. Now, you would expect that you'd have the same number of cancers in both groups, right? You know, they're randomized controlled groups. You'd expect the same number of cancers. But what they found is that those who had frequent mammograms had 22% more cancers. And the conclusion of this article published in Lancet Oncology was that these tumors naturally regressed. They cured, the body cured itself. That's a modern study that was actually cited by the U.S. Preventative Services Task Force in one of their papers. So 22%, you know, that's pretty good. And women who didn't change their diet at all, I guess, body just naturally killed off 22% of the tumors. Good deal. What if you armed the body with a real fighting fuel, huh? What do you think would happen? And you want to use these other therapies offered to you with the question, will this do me more good than harm? You got to ask that question. You got to ask your recommenders that question. If the doctor is recommending something to you, the doctor is a recommender. It is his or her obligation to prove it works. It's not my obligation to prove it doesn't. It's their obligation to prove it works. They're the ones that are recommending it. But I find myself in a defensive position. I've got to show you folks that it doesn't work. And believe me, there's no contesting out there. I've been talking this way for over 45 years. I actually, one of the stories that I'd love to tell you someday, and I think I did on this forum with AJ, is how in the early 1980s, I got the third informed consent law passed in the United States. Well, informed consent law requires doctors to tell women that the consequences of treatment are essentially the same, just like I told you, by law. 22 states now have informed consent laws, forcing physicians to tell their patients the truth. Why would you require laws to have doctors act responsibly? It's because doctors are people, and they do things that are not necessarily always right or truthful.
People are asking about Premarin, HRT, how long it takes on a plant-based diet for the immune system to fight cancer, things like that.
As soon as you shake the last bite of garbage, you change things around. It happens quickly. So as far as HRT goes, HRT promotes breast cancer, but it also makes the bone stronger. It also makes your vaginal tissues much more functional. So those women who decide that after their time in life when they can have babies, decide that they're not going to quit their sex life, they may need a little extra help with estrogens. And I prescribe estrogen topical creams for the vagina to fool Mother Nature. In other words, there's no reason to have sex after menopause. That's what they say. So you know, if you're going to fight Mother Nature, you might want to take a little risk and topical creams. They're not associated with increased risk of breast cancer using vaginal creams. At least, you know, so far they're not associated. And I prescribe skin creams, and in the McDougall Program for women, which again is free, I laid out a whole prescription. You can bring it to your doctor and tell your doctor you want to be treated this way. You don't go to a pharmacy that just takes bottles of big pills and put them in small bottles. That's what most pharmacies do. You need to go to a compounding pharmacy where they actually make up these preparations as skin creams. Now, skin cream is so much more potent than a pill. But with pills, when you take pills, estrogens, progesterones, testosterones, et cetera, there's something called first pass kinetics, where the pill in the stomach, the drainage of the stomach is directly to the liver. And the liver metabolizes these hormones and makes them weak. But when you put the hormone on your skin, it affects the tissues, the bones, the skin, et cetera, long before it goes to the liver. So it's like 10 times as potent. Skin creams are a big deal. They're good. I prescribe, but only for women who, menopause is normal and natural. You shouldn't be forced into thinking you have to somehow treat the disease of menopause. It's a normal, natural time in life. There's a time to stop having babies. And, in the human design, it's when you're 50. So you can live 20 more years to see your children grow up. So if you're having problems with this change in life, which is your last period, then you take some extra treatment and hopefully you do more good than harm. You try a little vaginal cream to help with the vaginal function. You take a little skin cream to help you with hot flashes, improve your feelings of well-being. That sounds reasonable. And protect your bones. Estrogen builds bones, also promotes cancer. So one of the puzzles from many physicians, including scientists, is the finding that women who are overweight have less osteoporosis, but they have more breast cancer. And the common denominator here is estrogen again. If you're overweight, you make estrogens in your body, which makes the bone stronger, but also increases your risk of breast and uterine cancer. So,
Robin says, is there anything you can do for vaginal thinning and discomfort other than the estrogen cream?
Change your diet. I've had many women with dyspareunia that's having trouble with sexual intercourse. And they have benefited tremendously by changing diet. I know she's going to come back and say she already eats good, but that's the only tricks I have. And using natural lubricants, and then trying to build the tissues back with estrogen. The vaginal tissue goes from a tissue that's 7 cells thick to a tissue that's about 1 cell thick when you go through menopause. So naturally, God says no reason to have intercourse because you can't have babies, which is, one thing that some of us don't want to hear about.
I just had Dan Buettner on the show. I should have asked him if all these centenarians are still having sex.
Yeah, I actually want to have Dan Buettner on tomorrow on the show that I'm doing.
What show do you do?
Well, we're building this new website, AJ, on diet therapy for planet Earth. And so I'll be interviewing experts. And Dan Buettner just happens to be the first one I've done this year. I did 12 experts last year, which are already up on both websites. The new website will be up in a month.
So can we see these interviews?
Yeah, you can actually go to my website now, look under education, or just put in Dan Buettner's name. And you can see the ones I've done with him in the past, my advanced study weekends. And yes, Heather will be sending out the interview from our McDougall Program website, and so you'll all be able to watch it. And,
maybe you can ask him what they're doing for vaginal dryness in the blue zones.
I'll ask Dan Buettner some tough questions, including the sex one.
Well, because he said on my show that alcohol is, really important for living longer, but all the doctors that I interviewed disagree.
Alcohol is, first of all, it's in my opinion, a professional sin for a doctor to recommend alcohol to people, because 9 out of 10 people, they drink it for relaxation and for enjoyment, but 1 out of 10 people that listens to your message about how good alcohol is for you is known as an alcoholic. And then they get in a car and they kill your family, or they go home and they beat the family up. Alcohol is a very, very difficult substance and should never be recommended by doctors. Alcohol, however, is, you know, AJ, the first people I've seen with clear arteries, you know, on autopsy. I did a lot of autopsies when I was a student. Skid row bums, alcoholics. They had baby clean arteries. Why? Because they were consuming a no fat, no cholesterol food, alcohol. Same thing would have happened with starvation, but you know, alcohol is not a good thing. I almost lost my job at St. Helena Hospital because of alcohol. St. Helena is in the Napa Valley. It's a Seventh-day Adventist hospital. And, you know, part of my responsibility was giving some lectures, and I gave lectures to the foundation, to the members of the foundation that they had. And Mondavi, Robert Mondavi was at one of the lectures. And I talked about, I said things like, you know, alcohol should not be recommended by doctors, et cetera. And, you know, Robert Mondavi got upset with me, to say the least. And I actually went to the administration, and, you know, there, of course, Mondavi Weiner is the big funder of St. Helena Hospital. And, you know, I just wouldn't say, I wouldn't say what he wanted me to say, which is, if you drink wine, you'll be healthier. You know, because that one person out of 10 that destroys everything in their path.
Well, that's what Dan said on my show last week, that people that drink alcohol live longer.
Well, you know, fine, maybe they do, but the social consequence is huge. You know, people, why don't, you know, there of course is a little truth to that, and you know, people love to hear good news about their bad habits. So my guess is that Dan Buettner imbibes. I don't, but I have in the past.
Yeah. Well, those are all the questions I see on cancer. We have other questions, but they're on other topics.
Let's see if we can get Mary over here.
Yeah.
Part of this new website involves, it talks about, I don't talk about the McDougall diet or a vegan diet on the diet I propose to help salvage the planet, to slow down the warming of the planet. But the scientific studies, they often identify it as a vegan diet. And of course, I didn't want to use our name, even though I think the McDougall diet is, you know, the perfect diet for this particular project, which is to save planet Earth. And instead of saying the McDougall diet or a vegan diet, what I do is I talk about a traditional diet. And I don't know whether you can see this or not. This is a coin. Here, Three Sisters. I don't know. I mean, this is the Three Sisters coin. They're dollars. I bought a whole bunch of them many years ago, and we lost those. And I finally found them on the website. You can order the Three Sisters. Three Sisters is about the American Indian. I mean, what could be more traditional for Americans than Native Americans? And their Three Sisters are squash, beans, and corn. So that's what I want people to eat. I want people to eat what 99% of the people who have ever walked this earth have eaten. The rich American diet is just a blip in history. You know, the fact that so many people eat like kings and queens and aristocrats has only happened in the last 25 to 50 years. You know, the other 750,000 years that the human being has existed has been on starch-based diets, except for those people who lived in extremes of the environment, like the Inuit Eskimo. Neanderthals lived on starch-based diets. We know that. So all you have to do is go back to the way most human beings have eaten in the past. In fact, it should be a cultural thing. When I was in Hawaii as a practicing doctor, I would often play the race card with my patients. They'd come and see me, and you know, like Hawaiians, Japanese, and Chinese, and Filipinos. And, you know, overweight, gout, diabetes, heart trouble, cancer, et cetera. And I try and convince them to change their diet, and they just, you know, didn't want to listen. You know how the resistance is. And so I would say to them, I'd say, you know, how's grandma and grandpa? What are grandma and grandpa doing? Oh, they're doing so good. They're, you know, thin and healthy and hardworking in their 90s. You know, what do they eat? Well, you know, Japanese, they lived on rice and vegetables, and my Hawaiians, they lived on taro and breadfruit and et cetera. You know, they can see it in their own family. And I would finally hit them with a race card, and I'd say, well, look what the white man's diet's done to you. You know, there you go. It's ruined your whole family. And that's what happened. And they had to take one step back to their mom and dad, their grandma and grandpa, to see the truth. Everybody can see this. Just open your eyes.
It's funny, Dr. McDougall Di just made a comment that only people that recommend alcohol are people that drink it.
Pretty much, there was an article in the San Francisco Chronicle, front page article about chocolate and how good chocolate was for you. It took up the whole front page. And I knew that people really enjoyed that article. People love to have good news about their bad habits. Be careful.
Yeah, absolutely. Well, hi, Mary, by the way, and your tree looks beautiful.
Oh, thanks.
Very festive.
Well,
She's good. Breathe, Mary. You okay? I don't need to lose her now.
moving my chair. Okay, that's better.
I'll just move the camera.
You should have.
Well, you're there now. Just say hello to the folks.
Well, hello, everybody.
We love to see you. Actually, this one question that I didn't get to last month, I bet Mary could answer, actually, because it's about the diet.
Okay, well, give me a try.
Okay, I think you could. This is from Andrew, and he said, where did it go? I was wondering why, if we stuff our face with bread and pasta, but don't add any fat, why it still makes us fat.
It doesn't.
It doesn't, yeah.
Well, it seems to be making him fat.
You're cheating. Look, I'm old enough to remember a time when in Asia, nobody was overweight. There were 2 billion Asians. Before 1980, their diet was 90% white rice. No one was overweight except for some special groups like the sumo wrestlers who ate a special diet in Japan. Otherwise, you could see newsreels of 100,000 people in a town square in Vietnam or Thailand or China, and nobody was overweight. They had no diabetes. Breast cancer and prostate cancer were essentially unknown. You've lived long enough to see this. It's right in front of your eyes. Rich foods make people sick.
So somehow or other, the fat is getting into the bread and the pasta, and the fat is what's making him fat.
Or it's highly refined food.
Oh, you should tell the story about the bread experiment at Michigan State.
Yeah, this is a study that probably some of you have heard about. I went to Michigan State University. That's where I got my education, both undergraduate and medical school. And that's where I had my stroke when I was 18 years old. Well, at that university, they did an experiment, possibly in the same dormitory I lived in, which was Snyder Hall. They asked overweight men to do just one thing, moderately overweight men. And that was to add 12 slices of bread a day to their diet. It's published in 1978 in the American Journal of Clinical Nutrition. They didn't tell them to eat fewer hamburgers or less butter. They said, you got to eat these 12 slices of bread.
They didn't even tell them what kind of bread they had to eat, except some of it had to be brown bread and some of it had to be white bread, but they didn't say you have to go out and find the healthiest bread you can find.
No, it was just kind of brownish bread.
Yeah.
Yeah, some were fine. They kind of divided them in two groups. Well, at the end of 2 months, those who ate the white bread lost on average 14 pounds. And those who ate the brown bread lost on average 19 pounds. By simply displacing fattening foods because they had to eat the bread. So what did the bread provide? Well, there's no fat to wear. And there's carbohydrate to shut off the hunger drive. The appetite is satisfied by carbohydrate. That's where you get your satisfaction. That's when you know it's time to stop eating, was when you get enough carbohydrate. That's sugar, by the way, folks, in case you didn't know. We recommend sugar in the form of potatoes, rice, corn, beans, etc. And also, it's less calorie dense. The breads are than, say, oil, a teaspoon of oil is like 135 calories.
Just to
And,
play devil's advocate, and I'm not disagreeing with you, but I don't eat bread and pasta, and I don't know if I could have achieved this weight eating that. Are some of us just more sensitive to the refining of the flours and things like that?
Maybe so, maybe so. When I come home from windsurfing, I usually have a half a loaf or a loaf of bread because I can taste the calories. There's something, I know you love to talk about it, AJ, and it's a book that I was forced to write.
I love that book, McDougall. My favorite book is McDougall's Program for Maximum Weight Loss, then Digestive Tune-Up.
Right. I always consider myself a doctor interested in treating the sickest of all patients. The sicker you are, the happier I am. And after about 20 years, I got talked into writing a weight loss book. And I know you love that book, and it's really an important book. It's still on the top selling list of Penwood Putnam. It's called the McDougall Program for Maximum Weight Loss, and it's about how to lose weight and why. It was an important book, but I never visualized myself as a diet doctor.
Wow. Well, you're a great doctor, whatever kind. So Daisy writes in, Dr. McDougall is a clinician who's cared for vegans for many years. What is your experience with long-term vegans that did not eat junk and ate a low-fat diet who still developed cancer? Are there more common types of malignancies, and what have the outcomes been in your experience?
I don't think I have a big enough population to really come to any conclusions, but I can talk from the point of view of geography, of world history. And what we find, and this was published by Dahl in 1953, what we find is that when people from around the world in various countries, when they eat a high-fat diet, they have more cancer, more breast cancer, colon cancer, prostate cancer. T. Colin Campbell's work, it was kind of fun. We had a lot of discussions. T. Colin Campbell and I we're good friends, and he did the China study, and I had him on my radio show to talk about the China study when it first came out. And he was talking about, well, you eat lower fat, lower. So how much lower fat do you need to eat, Colin? He said, I wasn't quite sure. And I said, well, why should you eat any fat? And he came back and he said, it was proportional. The lower the fat intake, the less the risk of getting breast cancer. But there was no cutoff. It's not like at 20% fat, breast cancer stopped. It was like you went down to 7% fat, which is the lowest you can get. And you were still showing a reduction in risk of getting breast cancer, which is essentially unknown in the rural Chinese population. So T. Colin Campbell started recommending a 10% fat diet or 7%, consistent with the China study. And by the way, there's a movie out. It's called Safe Haven. And they highlight the China study, Colin Campbell's book, in the movie. We saw it just a couple of nights ago.
Is it on Netflix or any of the other channels?
Netflix. It's on Netflix.
Thank you.
Safe Haven. Is it Safe Haven? Yeah. Great movie. I mean, it's well worth your trouble, even if you didn't want to see the China study book in reference to eating better. Occasionally movies come out. They'll have my book, Colin's book. They often have our foods. Dr. McDougall's Right Foods. They appear every place, on people's shelves, on their kitchen, and so on. You watch in the movies, you'll see Dr. McDougall's Right Foods sit on their counter. Why? Because these actresses and actors, they want to be trim and healthy too, and just like the rest of us.
Yep.
But this woman Star was sitting in her bed reading the China study.
Yeah.
And they didn't talk about it too much, but it was just.
But he talked. I think the subject of diet came up a little bit in the dialogue.
Yeah.
It was very clear that they were strong promoters of T. Colin Campbell's work.
Yeah.
Thank you. We'll watch that tonight. Thank you. Jocelyn says, how quickly after starting a daily walk for 40 to 60 minutes will my husband see a change in his blood pressure? He's running 120 to 125 over 80/85, and he's 90% whole food plant-based, no oils at home. He's still overweight, lost 25 pounds, but has 20 to go. He's 5'11", weighs 205. He does hibiscus tea twice a day, 2 tablespoons of flax in his oatmeal. Found out he has an enlarged aorta, but is on no meds, but it's important to keep his blood pressure under control and seems a bit high. That would be a perfect candidate to take the next McDougall program in January.
Yeah, we would love to help you get the last part of your journey taken care of painlessly. And we are running a program in January, February, March, et cetera. So yeah, take a look. We'll take care of you. We'll help you get the diet fixed. It's the diet. Exercise lowers blood pressure. but it's really the food that makes a difference. And by the way, those numbers are what we call at most mild hypertension. You know, they're even questionably hypertension because they're consistent with the average of Americans, which, by the way, that kind of blood pressure is associated with twice the risk of dying of heart disease than, say, a blood pressure of 110/70. And it all comes down to the same thing. It's the food that raises the blood pressure. It's the food that gives you heart attacks. It's not like high blood pressure damages the arteries and gives you heart attacks. It's the food that gives you sick arteries. And at any pressure, they rupture. Anyway, to answer your question, he just needs to refine what he's doing. He should be congratulated on the progress he made, but it's going to be the food that makes the difference. And right now, he shouldn't worry about having a terrible high blood pressure. It's mild at best. It's below what the American Heart Association recommends we treat with drugs. It's below what the National Health Service recommends that we treat with drugs. It's below what the Cochrane Collaboration recommends that we treat with drugs. They recommend somewhere between 150 to 160 over 90 to 100 millimeters of mercury pressure sustained for months before you initiate drug therapy. So, you're not even a candidate to go to the doctor and get drugs. And there's only one drug I recommend for treating high blood pressure. It's called chlorothalidone. And you can look at our website, drmcdougall.com, and you can find a full discussion of how I treat high blood pressure.
Great.
But
we've had so many people come through the program with moderately high blood pressure like that.
Yeah.
And, a couple days later, when we see them for their morning chat, it's like, oh, my blood pressure went way down.
Yeah.
Just by changing a few things that you learn in the program, it makes a difference.
Yeah, it really does. And it's not like you have to be perfect, but sometimes you do. And big changes get big results, and you deserve the health that you're asking for. But you've got to do the right thing. You can't be moderate, reasonable, sensible. You've got to just knuckle it down and eat a starch-based diet. And pretty soon it becomes your favorite way of eating. It has for all of us. I bet we could have. We just didn't have John at the beginning of the show. We could have probably 100 people who are listening tell you the same thing. I love my food. I don't have to apologize to anybody. I don't find that old stuff appealing at all. It's disgusting. It's greasy. It's foul. And that's even when it's fresh, it's foul. So, you have a chance to change. It's just a matter of deciding you're going to do it. And that's all it boils down to, is you have to decide. It's like people ask me often, how do you write a book? We've written 13 national best-selling books. And the way you write a book is you make the decision to write a book. And that decision is you put the first word on the paper. The rest of it's easy. Decide for yourself that you really want this for whatever reason. You want to spend time with your grandchildren. You want to have another nice dinner with your wife. Why do you want to do this? It's important. And then you decide what you do. And we've told you exactly what you should do. We haven't pulled any punches, and we're there to help you. I mean, if you attend the 12-day internet telemedicine program, we take care of you all the way from Dr. Lim, who takes care of your medical issues. And I get involved once in a while, kind of help out. The old man knows some things that the young guy still has to learn, but he does really good. He's the best doctor I know outside of, who. And so we have support staff that every morning they meet with you. They talk to you about your blood pressure, your blood sugar, and they talk to you about your daily meal plan. And then we have all kinds of great lectures by Anthony Lim, Doug Lyle, Jeff Novick, myself, Heather, and also some of the patient population that we've had in the past. They come out and they talk about how their lives have been changed. It's an amazing program. And it costs you about a third of what the resort-based program used to cost.
And AJ cooks for us.
Oh, yeah,
too.
and AJ cooks for us too.
I know. That's really fun. I really love it. Yeah, it is.
It's really fun to have successful outcomes. And that's one of the most enjoyable things about our program that our staff likes, is that, yeah, it's difficult. It's, we run into all kinds of problems with people initially making the change, but pretty much everybody gets better. pretty much everybody leaves the program and says, that's the best money and time I've ever spent. And now it's effortless. You do it over the internet, and there's no barriers. It should be easy for you. And, you can always go back to the website, and there's a free program on there that I published 30 years ago, which is, you could do it from the free program. In some of the books I've also put in the free program. It's free. It's free. You have to. Why did I give it away free? Well, at one time I couldn't sell it. And Mary and I have enjoyed excellent health. We're in our mid-70s. And we feel we owe a little bit back to society for spreading this knowledge in our lives. We would like to spread it to other people's.
Yeah.
You tell me where the gimmick is. People look at our website and they go, wow, I spent a week looking at your website. Where's the gimmick? Where's the pitch? Where are you trying to sell me stuff? Well, we have a business, and that's the 12-day program, which is, it's a great tool. It'll make all the difference you can imagine. We used to run resort-based programs. We used to run adventure trips, take people around the world on a vacation with McDougall food. But we don't do that anymore. Basically, what we do is we do the program, the 12-day program, which is run by Heather McDougall, and with my participation and Mary's participation every day. Every day, Mary and I get together with people. Every morning we have a fireside chat, and people say they really like that. And prior to our fireside chat, they have meetings among themselves where they can sit and talk about how they're doing, what they think of John and Mary and the rest of the staff. And, it's completely their time together, and they love that. Seeing other people in your program get better is really, really encouraging. And to talk to other people, we have that opportunity every day. And afterwards too, I have to mention afterwards, the program is supportive. We take care of you at varying degrees of intensity. We take care of you for a year or longer. You can be on our support list forever. It's just about a year is included in the program. So I don't know what you're waiting for. You're wasting time not having the personal appearance and health that you deserve.
If not now, when, right?
Yeah, just fix the food. It's
Well, speaking of food, they want to know what Mary's fixing. Melanie asks for Christmas.
Oh, Christmas. I would guess probably sweet potatoes.
Yeah, but see, that's not the real question that I answered. You're going to take sweet potatoes over to Craig and Nika's, and we're going to have mashed potatoes and dressing.
Oh, yeah.
They want to know where they can find your typical holiday meal. Back when we used to be hosts for our entire family, and Mary used to cook everything. And what did she fix?
Well, the easiest way to find it is to go to our website, which is drmcdougall.com. And in the corner where the magnifying glass is, you put in the search box holiday meals, and you get a whole must be 14 pages at least.
When Mary put this together, it had been about 25 years ago. I said, Mary, write it so a 7-year-old would understand it. Write it so nobody could fail. And so she went into such great detail, like, this is when you buy this, and this is when you start to put this together, and so on. So you got it. You got the whole thing very simple for you. And consider that Thanksgiving and Christmas, well, let's just talk about Thanksgiving, because Christmas, it gets a little wilder. But Thanksgiving, which is a traditional holiday, is the lowest fat, lowest meat, highest vegetable meal that people have all year long. This is the biggest food celebration, Thanksgiving. But that's not what happens. You go to the Thanksgiving meal, you have the healthiest meal of the year, and every meal after that is downhill. It's richer. In other words, more meats, refined foods, oil, dairy, etc. It's richer than their Thanksgiving meal. So, and I want you folks to know, I tell them this, and I kind of joke, thinking that I'm going to win favor. I'm not sure I have. I kind of joke about how I'm not vegan, that I eat turkey for every other Thanksgiving, a slice about this big. Well, you will never know whether I really do or don't, but I can tell you honestly, I didn't this past Thanksgiving. Me and our granddaughter, Chloe, who will not touch anything from an animal. She's what, 9 years old?
Yeah, she's nice.
She and I sat there and we had no turkey at all. And probably next Thanksgiving, I'll do the same. It just is not my thing. I don't eat any animal products. So, because
And if you go to this holiday meal planning, it gives you a huge menu. And so you can base it on what you want to make, on how many people you're going to have at your party. And the recipes are right there, so you don't even have to look for them. Tells you how to make them, tells you when to buy the stuff to make them. It couldn't be any easier.
Yeah, like I say, she wrote it for a 7-year-old. And
Want to know what I'm having Christmas? Let me tell you what I'm having, then I'll tell you why. We're having aloo gobi, Korean barbecue tacos, saucepan scallop potatoes, barbecue pulled pork sandwiches made out of jackfruit, mushroom and cabbage mushu, green curried potato tostados, and tomato bisque with rice. Do you want to know why I'm having that kind of weird menu? Because
I want an invitation to dinner is what I want.
Really?
because we work a lot, and that's the only day Charles has off to shoot my annual Forks Over Knives video. And so since we're just going to eat what we make for the video.
Oh, wow, that's great.
Yeah. But you're welcome here anytime. Hey, here's a question that gets a lot of people upset because most people are trying to lose weight. But this lady named Jane says that she started this way of eating 8 months ago to help her husband who had a heart attack. But now she's losing too much weight. She's 67 and her body mass is 18, 5'6", and 110. What can I do to stabilize my weight?
Well, you look at my May 2003 newsletter, and it talks about what do you do if you lose too much weight. And first of all, it is all based on perspective. People who knew you as being 40, 50, 70 pounds overweight, when they see you new, they think something's wrong. It's natural for folks not to want to change the personal recognition of other people. And so the initial conclusion will be, when those who knew you before, is that you're too skinny and maybe you have AIDS and maybe you have cancer. But people who meet you new, they'll look at you and go, wow, you really look great, because they don't have this preconditioning. It starts out with a discussion of Walter Kempner's weight charts. And those are in my November 2016 newsletter. Walter Kempner's weight charts will shock you, but it explains to you why you haven't lost too much weight based upon what Walter Kempner recommends. I'm lower than Walter Kempner, so is Mary. We're lower than what Walter Kempner recommends, but we seem to be doing okay. You look good to me, Mary. So, anyway, but you can fix that too. If you want to gain some weight, you just, in a relatively healthy way, you eat more bread, more pasta. We talked about that, about more refined products. You would eat more fruit, maybe add some fruit juice to your diet. And then as a last effort, you'd add high-fat plant foods like nuts and seeds and avocados. I can make a meal plan that's 90% fat, 80 to 90% fat. The fat you eat is the fat you wear out of those vegetable foods. You know, nuts and seeds and avocados are fattening.
Oh man, I haven't touched them in 10 years and I get a lot of grief for that, Dr. McDougall. People say that I'm killing people. I don't tell other people not to eat nuts, seeds, and avocado. I just haven't touched them, and it'll be 10 years on January 2nd. And I haven't dropped dead.
Yeah, you know, AJ, you're a very determined person who takes action when you see something that's true for you. And you're committed. You're in many ways like me, is okay, that's the way it is. I'm going to do it. And you've maintained your personal appearance and your, the trim body weight that I'm sure a lot of people are very, very envious of. I've seen you in a fancy dress, man. You look good.
Thank you. Well, it's just like once you get it, it's like when you've been fat for 50 years, why would you want to risk anything to do that? Because I feel so bad for people that lose tremendous amounts of weight and they gain it back.
Yeah. Well, it's because.
But don't you have people that say to you that you're too skinny?
It's like Dr. McDougall said, the only people that tell me that I'm too skinny are never as skinny as me. It's like, it's like these famous, it's like people that bash you on social media. they're like, famous people never bash people, right? Like, they're not doing that. And it's like, the only people that ever tell you you're too thin are people that are heavier than you. So how can you listen to them?
Yeah.
Well, the reason people give up on diets is because they're approaching it from the point of view of causing themselves the pain of hunger. You can't sustain that kind of pain. It's just that's why 90% of people regain the lost weight is they can't stand to be hungry. It's like asking somebody to be thirsty or to be short of breath. These are natural survival mechanisms that you can't beat. The only way you can beat them is to make yourself sick, and you do that with low-carb diets. Low-carb diets make you sick. That's how they work. Initially, you lose water weight, about 8 pounds, because you mobilize your glycogen stores. After that, you go into ketosis, which is a condition that occurs when you're sick. You're either sick or you're in pain until you discover a starch-based diet. Then all of a sudden, everything's within your control. You know, if we were selling you something that, a supplement or something, that'd be one thing, but this is potatoes and corn and rice and beans, and just eat it. In fact, our diet is so simple, just like yours, AJ, is, Mary and I have the same few things every day to eat. Love it.
I haven't gotten sick of eating the same thing every day for like 10 years. Sweet potatoes and broccoli. What could be better?
Yeah, it also takes a lot of the worry out of your meal planning, doesn't it?
It makes it so much easier, and it's cheap.
Yeah, it's cheap. And by the way, we enjoyed the sweet potatoes that you sent to us.
Oh boy, I guess I'll have to get another one for, what's
Really
the next
hearty.
holiday? And those are delicious. All right, so question this is on autoimmune disease from Michelle. Hi, Dr. McDougall and Mary. Ever since I found you on YouTube, I've been hooked on this way of eating. I'm in menopause for almost 5 years and have had alopecia 3 times and thyroid problems. My natural doctor suggests things like prolamine, iodine, B12, AF, beta food. What's your suggestion for curing my autoimmune symptoms? To take the McDougall program in January. That's my suggestion.
Autoimmune diseases are due to something called molecular mimicry, and they're discussed, of course, on our website. What happens is you eat animals. Now, I know you don't eat animals now, but you eat animals, the animal protein, like, for example, the hair follicles. Okay, the hair follicles from the pig or the cow are absorbed. Proteins from these hair follicles are absorbed through your gut wall in your bloodstream. They appear. And the body interprets these foreign proteins, in this case from the hair follicles, as viruses or bacteria or some other invading agent. And the body makes antibodies toward these hair follicles. Well, they're not all that specific. So even though they're against the hair follicles of pigs and cows, you got hair follicles too. And it's close enough it's close enough that sometimes the body makes a mistake and it attacks your own hair follicles. Anyway, that's how you get alopecia. As far as thyroid is associated with conditions where people have brittle hair and they lose their hair. So thyroid disease is due to the body attacking the thyroid gland. When you go to the doctor, you'll be told you have autoimmune thyroiditis, or in other words, Hashimoto, who in 1917 described this particular condition, a Japanese doctor. So you ask, well, why is the body attacking itself? Why is my body attacking itself? Well, the same thing, I believe, is that you eat foreign thyroids. You eat pig thyroids and cow thyroids. How do you eat pig thyroids and cow thyroids? Hot dogs, sausages. And the body recognizes these as foreign, but not totally foreign. Molecular mimicry, you can look it up. Molecular mimicry, copy in other words. And the body attacks your own thyroid gland, and once it's destroyed, it's destroyed. You need to take supplemental thyroid, and I do not recommend natural armor kind of thyroids. They stink. Why? Because they come from cows and pigs. And they also carry various microbes to you, viruses and prions, et cetera. What I recommend is Synthroid, which is a synthetic thyroid supplementation. I've used it for more than half a century. And I found that if you do it right, there's never a problem. People just do extremely well. It's a fun way to treat using medication, a supplement. I guess I call it more of a supplement. So that may be related to your hair loss. Otherwise, I can't explain it. There are a lot of things I don't know. So, give me a break.
Nice. Well, maybe you know this one about thyroid. This is from Armando. Dr. McDougall, it was stated during your last session with AJ that you believe that no one ever dies from the numbers. I'm wondering if you believe this applies to hypothyroid as well. My TSH is 6.85 milliunits per liter, but I have no symptoms. Doctor wants to put me on levothyroxine, but I have so far refused as I have no clinical indications, been whole food plant-based 8 years. Will my condition get worse if I don't take medication? Is there some point where I should take medication based strictly on the numbers alone, even if I don't have symptoms?
Well, this isn't a matter of the TSH level, which is the blood test, causing you to have a absence of thyroid function. I just explained to you the autoimmune issues. TSH is the only test I use to determine the thyroid status of our patients. Normal TSH level is 2 microinternational units. If you take too much thyroid, then it becomes lower. And that's not good, because taking too much thyroid or having a hyperactive thyroid gland results in bone loss and heart irregularities and anxiety issues. It's not a good idea. You got to take the right dose. So what's the right dose? It's a dose that makes your TSH level around 2, maybe 1, maybe 3. Okay, when do I start treating people with supplemental thyroid? When they get to, say, 6, 7, 8 TSH microinternational units. I've had people with TSH levels of 20 and 30. They're in big trouble. People do die from this condition. They get, anyway, they get all kinds of heart complications and other complications. You don't want to leave a thyroid condition untreated. And any doctor, any competent doctor out there in your community knows how to treat hypothyroid issues easily. And so it's not like you have to search for an expert. Everybody's an expert.
Yep.
It's one of the standard therapies, the least toxic therapy I know of. It makes so much sense. You've destroyed your thyroid gland. You need to have that hormone. The thyroid gland's the master gland in the body. It affects every tissue. Fix it. And then it repeats your TSH level. It takes about 3 to 6 weeks for Synthroid, which is T4, to start working. So you got to wait. At least 3 weeks, and probably as long as 6 weeks before you see the effect of the supplement you take. So don't be fooled by starting the supplement, checking the blood test a couple of days later, and it's not fixed. It takes a while for the hormone to become active.
So I want to respect your time. There's 13 more questions. You want to save them for next year?
I don't. Whatever you'd like to do, AJ. We don't have any particular issues.
Any pressing? No pressing engagements. I'll whiz through them.
I'm gonna have for lunch last night's leftovers.
What was last night's dinner?
Leftovers from the night before.
Oh man, I'll tell you.
Well, no, what I had 3 different kinds of leftovers. One was rice, and one was a bean dish, and one was Spanish rice. One was just a grain, just a rice.
You use that microwavable brown rice, yes?
Yeah, and I put that all together, and it didn't look like it was enough, and so I took some frozen vegetables out of the freezer and heated them up and added it to it, and it made too much. And so now we have something left for lunch.
You have leftovers from your leftovers.
Yeah.
We have several good sauces that she uses on them to give different tastes.
I just sent you some for Christmas.
You did.
Yeah.
And one of them is really spicy, blazing habanero.
We use more and more frozen food these days because we don't want to go out. We want to keep our exposure to the public as minimal as possible, and you know why. So we'll go to the grocery store maybe once every 2 weeks, and the fruit's not going to last 2 weeks, and the vegetables aren't going to last for very long. But we found that buying frozen fruit and frozen vegetables, Mary can make a very easy, very convenient meal for us right away. And Then of course we have oatmeal every morning for breakfast. I buy that in the 20-pound bag.
And we add frozen fruit.
Fruit, yeah. Frozen fruit and vegetables, or and oatmeal, frozen fruit and oatmeal. You can't beat that. Yeah.
Nice.
It's simple. Consider the fact that most people have walked this earth have lived on a single starch with fruits and vegetables in season. They didn't have a grocery store with 60,000 items in it. They ate from their local environment. They like the three sisters I showed you about, the story of the American Indian, the Native American. That's probably the right way to say it these days, isn't it?
Yeah.
The Native American, and here she is. She's planting beans, corn, and squash, which, by the way, they complement each other as far as their growth goes. One supplying nitrogen for the other. And
isn't that Sacagawea?
yeah, that's right. That's right. That's who it is.
From this area.
Yeah. The three sisters. That's what you should be eating. The Native American was here for a long time, thousands of years before the invasion from Europe. And of course, it took a while before that invasion for Europe decided that we were all going to eat like kings and queens. It's only been the last 50 years, 75 at most, that people have eaten this way. This is a blip in history. This is something that could and should be fixed. You are a starch eater. You are a starchivore. You're helpless unless you have this understanding. You eat like most people who have ever walked this earth. Pick a starch. Pick 2 starches. Pick 10 starches. 90% of your meal plan by eyeball, not by measurement, not by counting calories. You just look at the plate and you go, oh, most of it's starch, 90% starch. I'm going to have some vegetables along with it. If you want to lose more weight, you can make it more vegetables. And that's part of the maximum weight loss program. But it's so seldom, as I say, you can look at populations of 2 billion Asians. Nobody's overweight before 1980. They had financial problems. They had infidelity issues. They had children who gave them trouble. They had all kinds of stresses in their life. Many of them did not exercise. They were school teachers and preachers and, shop owners. And they weren't out working in the fields, heavy exercise. But they all were trim. Why were they all trim? Because the natural habitus of the human body is to be trim. It's your best chance of surviving to be trim. And maybe put on a little fat for the winter.
Dr. McDougall, I believe what you say about the fat you eat is the fat you wear. I have it on a t-shirt. I have it on a mug. I have it on a card. But why is it Charles eats so much fat and cannot gain fat, no matter what he does? I mean, he keeps, we force feed him nut butters and bread. And why isn't the fat he eats the fat he wears? Why is he such an anomaly?
There are just some people who are skinny even in the face of all those calories. I don't know. They maybe, there are a couple of possibilities. One is he's a very active guy. I've noticed he's always, he's
married to me, right? So he's got to be.
He just doesn't sit around. I mean, he's always moving. He's always, fidgeting.
He is. He's always fidgeting. Yeah.
Yeah. So he's burning a lot of calories that way. And he may not be absorbing the fat as efficiently as, say, some of us do. There are people who don't absorb fat well. And, what happens is they usually get diarrhea. I know I'm not going to get in Charles' history, but people do differ in their response to food.
I smell the peanut butter jar and gain 5 pounds. I don't even have to eat it.
I'm that way too, AJ. I mean, I eat a lot of food, and sometimes we don't necessarily restrict.
You don't gain.
No, I'm 140 pounds. Walter Kemper says I should be 150.
Wow.
I used to be, many of you knew me from a time when I was 150 to 180 pounds. But I was traveling. All over the United States selling books on various TV and radio shows. It was hard. And of course, it gave me a chance to be a bad boy on occasion too. And when Mary and I got married, I was 190 pounds. And my highest weight that I can remember was I was 228 pounds. And that was when I was 22 years old working in the hospital. And the reward for working at the hospitals in Grand Rapids was free food. So you could go to the cafeteria lines as much as you wanted and fill up with burgers and pork chops and so on. And I got up to about 228 pounds. So that would be 30 and 7, let's see, 30, and that's 90 pounds I weighed. So I've been there. I know what it is. And I certainly don't want to be that way again. When your mother calls you fat, you know you got trouble.
That's funny. All right. I'm going to just keep talking until you tell me to stop. So, because
I'm going to go to the bathroom
if
and then I'll be back.
yeah.
If people get tired of listening to this, they always hang up. Maybe you ought to put an edited version of this
Well,
up.
so far they don't. If you guys type in the chat if you're tired of listening to Dr. McDougall, I doubt that would ever happen. But this is an interesting question from Sandra. She says, someone pointed out that potatoes, tomatoes, and eggplants contain nicotine. Is there a difference between ingesting and inhaling nicotine? Is the amount of nicotine in nightshades as detrimental as smoking?
No, not so. You don't want to eat spoiled potatoes. They have, you see it as a green toxin. And, when you eat a plant, you're eating a perfectly balanced organism that has, all kinds of effects where the outcome is good. When you start refining it, like for example, when you take amygdaloid out of apricots, and you get a cancer chemotherapy drug. I remember that in the old days to talk about that. You've taken a perfectly good apricot and you've turned it into a cancer-fighting drug. When you start refining things, what happens is you lose the natural balance in the food, which has been something that's been designed and going on for millions of years. This planet's been around for a long time and millions of years of evolution. God or nature or however you want to put it in your mind, what is happening, it's a miracle. I'm so overwhelmed. I find it upsetting that I don't get to see what the future is going to be. There was a program on yesterday on Sunday mornings. I think it's called CBS Sunday Mornings, about how they just launched this telescope. It's going to be 1 million miles out in space, and they're going to be able to see the beginning of time and have all kinds of visions of different planets and solar systems. I would really love to be alive to see that, and I won't. Just because I'm my age. Everybody has the same outcome. But it's so exciting, the world we live in now. It's just too bad that we have done such damage to it. It's not hopeless. That's why we have the new website coming out called Diet Therapy for Planet Earth. You can do your part as far as cutting warming gases. Yeah, you can do your part. You can cut your production of global warming gases by 80% overnight by changing to a vegan diet. So get busy. You wonder what you can do besides driving a hybrid car or recycling. Change your food. Then you can help your grandkids, your kids have a possibility of a future. And it could be an exciting one.
Yeah.
I'd like to believe so. I'd like to believe that we are just going to get things so fixed and just move on. And our civilization, maybe someday will be like Star Trek and get to visit other worlds. But that's kind of like I'd like to live in that kind of a world where it's full of optimism. I loved Star Trek.
That was good. What do you watch on TV?
Oh my goodness, we have a whole list of movies that we've enjoyed, and we share those with family and friends. But we also watch some of the new shows like. Well,
we watch Rachel Maddow.
Well, that's the political show. Shepherd Smith. That's a good news show.
Yeah, Shepherd Smith's good.
And we do.
You don't want political shows. Huh?
Well, if you tell people you watch MSNBC, they know what you're
okay.
thinking is you. But we also watch Fox News.
Yeah.
Yeah. Just got to see what the other people are thinking. So, but how about the entertaining shows that we watch? We have a few series. We had Queen's Gambit.
Oh, the Queen's Gambit.
Yeah.
And we like Ted Lasso.
Oh, Ted Lasso was amazing, wasn't it?
Yeah.
And the morning show is really good too.
Wow, we watched some of the same things. That's so cool to know.
No, good TV is good TV. I am kind of the elected person in the family to sort through all the garbage. And I have to go through about four movies before I find one that's good on average. But they know, my family members know that when I say, you got to watch this one, you got to watch this one, it's good. But, you know, that's kind of what I do is I go through the garbage.
Yeah, we sit at night, you know, after we have our meal and after we clean up and after we're kind of ready to settle down for bed. And then we go through movies that John has picked out. And after about 10 or 15 minutes, if we both hate it, then we don't go to the next one.
But there are some good movies out there, some good shows. We have an amazing society, a wonderful world. Oh my goodness. Seems like such a shame not to make it even better. And we're doing it in our way, which is fixing the food. It's the food. It's the food for our personal health. It's the food for the environment. But, you know, I used to think back in 1978, you know, we'd already changed our diet for a year. I used to think that all you had to do was release the truth and everybody would clamor to it. And I discovered that was not true. I remember telling my chief of staff that, you know, people are going to flock to my office door. There's going to be a line from the Honolulu International Airport to my office waiting to see me because I have the cure. You know what? That line's never formed. We've had a chance to take care of a lot of people. I had a lot of fun doing it. But I'd have to say, if you're going to look at the overall picture, those people who are teaching unhealthy things are dominant. I mean, consider the fact that when I was a kid, 17% of the population was obese. Now it's up to 30 to 40%. It's predicted that as many as 70% of people will be obese, not just overweight, but obese. People from Mississippi and Louisiana and Georgia, you know, the southeast part of the country are particularly susceptible to the bad diet. And the prediction is by 2030, somewhere around 70% of people will be obese, not just overweight, but obese.
Well, don't you notice, like when you go out shopping, which we don't do except very rarely these days, but almost everybody in the store is overweight. You don't see skinny people anymore.
Even on the commercials on TV, or you know, particularly commercials on TV, it was a big shift to, I guess they wanted the consumer to identify with them. And of course, when everybody is overweight who's watching the TV show, you don't want to have skinny people.
You don't see skinny people much.
Yeah.
Yet when you watch a movie from the 50s, everybody, except for maybe one character actor, like say Stubby K in Guys and Dolls, was lean.
Yeah. Everybody was white back then too, remember? Those are some bad times.
Oh boy. So Karen has a question. What's your thought on organic versus conventional?
We recommend organic, but we don't teach it. And because we don't want to put up another obstacle, but Mary and I make great effort to buy organic. You know, at the very least, it helps the farm worker because they're the ones that have to apply the herbicides, the pesticides. At the most relevant issue is that these chemicals cause brain damage, including Parkinson's disease. And in fact, it might be a little fun for you is go to the internet, look up Parkinson's disease and pesticides or organophosphates. You'll be overwhelmed. You'll read for the next week scientific research that clearly shows that Parkinson's is due to poisoning of the substantia nigra of the brain with organophosphates. So brain damage is expected, more severe brain damage like Parkinson's, cancer initiation and promotion, as this lecture I gave you at the beginning of this hour. You know, these are the consequences. And boy, the runoff, you know, you see what's happening in the environment by this kind of behavior. It's greed. It's natural human behavior, greed.
Cool. Here, yesterday, Dr. McDougall was at the GI Health Summit, and you gave your lecture, and it was wonderful. And I guess this question from Kathy, it's possible that she saw the lecture. It's about gut motility. Is low sodium a cause for concern? Can it impact gut motility, slowing it down, contributing to constipation in a 61-year-old SOS-free plant-exclusive eater?
I don't know that. I've never known a mechanism where sodium causes looser bowels and lack of sodium doesn't. It may be that when you're on a low salt diet, you're not eating as much food because it doesn't taste good. That's why we don't recommend a salt-free diet, because I want you to eat the food. And so we recommend a starch-based diet with the use of salt and sugar and spice as a condiment on the surface of the food, because I want you to eat the food. And I ran into an interesting issue. As I say, I get involved with the 12-day program patients, every program. And I ran into an issue where a lady said she got constipated when she switched to our diet. And, there's no reason to question her. She was trying to convey to me a change that took place. Well, it took me a while to figure out what happened. What happened was she was having bowel movements prior to us because of the fat in the food. Fat causes the liver to produce bile acids. These bile acids get into the large intestine and cause loose stools. In fact, they cause explosive watery diarrhea, 20 stools a day. It was published in 1973 in the journal Gut by a doctor named Andreessen. And by the way, you'll get all these scientific articles when you attend the program, because that's part of the benefits we offer you, is a full access to our archives and videos and so on. Anyway, Andreessen found out in his patients who had problems with bile acids, due to a high-fat diet and due to damage to their intestine, that he would change people from having 20 or more watery stools a day. They're tied to the bathroom, to 2 to 3 formed stools within 48 to 72 hours. Yeah. So what happened with this patient is that she cut the fat out of her diet. The fat was causing her bowel stimulation. So she was having, quote, normal bowel function. And when she got the fat out, then she had a problem with no more stimulation from the bile acids produced by the high-fat diet. So what did I do? I put her on some, what's Chris is called?
Yeah,
Swiss Chris, which is a kind of a fiber supplement, and a little bit of prune juice, and she's doing really well. Not a problem.
Great. Okay. So this was a question. Where did it go? I'm so sorry. I jumped screens. But I don't want to go. You don't want to talk about COVID, right?
I don't care. I actually find it one of the more interesting things that I watch.
Well, and Nadine says, do you endorse getting the COVID vaccine booster?
Absolutely I do. I'm a real doctor. I'm a scientist. I believe in science. These vaccines are far from perfect, but I believe, unless I consider the experts out there who I think are honest, hardworking people, I consider this to be scientific fact based upon studies. And what I hear, what I understand, what I read is that vaccination for COVID, at least now, against the Delta variant and the COVID-19 original virus, is effective, particularly at keeping you from ending up in the hospital on a ventilator, dying by drowning in your own lung fluids for 2 weeks and then dying. That dramatically reduces your risk of that. And Mary and I are fully vaccinated, and we'll get the next shots that come out. We'll take those. But don't forget, a more important, more effective, safer way to enhance your chances of staying healthy is to eat a healthy diet. If you notice, people who are in the pictures in the ICUs that you see on your evening news, most of them are obese. They have what we call comorbid factors. And if you have comorbid factors, which are the things that we cure, the things that are due to the Western diet, you're the kind of person who ends up in the hospital, ends up dying, ends up having complications. So it's one thing you can do that's cost-free. Get rid of the comorbid factors. You're suffering from food poisoning, and you can fix that right away. So, we have some confidence in the fact that both of us are real healthy. We're older. I told you we're in my mid-70s. We have taken advantage of the vaccines and the booster, and we'll take advantage of any other vaccines that come out that suggest they'll help us. I'm not going to throw the baby out with the wash water. It's just the way it is. The other thing that we do more and more is we are isolated, which is painful. We're getting to a point where we're having trouble visiting our grandkids again because of what's going on in the world. For a while there, we were really, really isolated. We had our Thanksgiving dinner outside in the garage with these, heaters. For a while there, we'd never go into our son and daughter-in-law's home because of the fear of COVID. And then we entered another era last summer where we had some indication that if you were vaccinated, things would be better. But the statistics show that we're back to a worse situation. From what I see in the news, with the number of cases, the hospitalizations, the deaths, we're at the beginning of a very steep climb. And with the Omicron, how'd I do?
Omicron.
Okay. But the Omicron, the new virus that's so contagious. Do understand that these viruses are carried airborne. And they last just like the chickenpox virus used to last, or the measles virus. You remember back in the days when we had chickenpox, if you went into a school classroom 4 hours later, or even the next day, you're very likely to catch chickenpox. These virus particles, they stay in the air. Social distancing has to be taken seriously. And wearing a mask, although we recommend it, is not as much distance as you need. You need to be very careful about your interactions. And will we see the grandkids again? Yeah, we will, because we're going to take the risk. But right now they're sick. Both of the kids are ill with not COVID, but kids that go to school are sick because the viruses are passed around. So we didn't see them for the last couple of weeks, the grandkids.
Oh.
Painful.
Question from Gail. Dr. McDougall, have your views changed about supplements? I'm a 60-year-old female and I want to make sure I'm not missing anything. I hear a lot about magnesium these days.
Right. Well, no, they haven't changed. But you can say, well, he's just inflexible. No, supplements are at best, they can have some effects. They can be medicines. Now, supplements like thyroid supplement, that's a supplementation I recommend. I think you're talking about vitamins and minerals. Well, if you take vitamin and mineral supplements, you cause nutritional imbalances. Like, for example, beta carotene. Beta carotene, when you eat it as a pill, for example, if you eat it as a carrot, no big deal because it's properly balanced with other carotenoids. But you take a supplement of beta carotene, concentrated, isolated beta carotene, and it goes into your gut, into your bloodstream, and then into the cells. Well, there are 50 different carotenoids that the body interacts with. There are about 600 different carotenoids in nature, but 50 of them that we have to deal with in terms of good health. They are all activated by an attachment to a carotenoid receptor. In other words, all of these 50 carotenoids, they have to attach to the inside of the cell to this carotenoid receptor before they can function. Well, when you flood the system with beta carotene, just one of the 50 carotenoids, there's no more room for the other carotenoids. And you increase your risk of getting cancer, heart disease, dying. That's basically what all the studies show. You cause nutritional imbalances. Similar mechanism when you take vitamin D or vitamin D shots. You need to get these things as they were intended to be consumed. Vitamins, 11 of the 13 known vitamins are made by plants. Okay? One is not a vitamin, it's a hormone, it's called vitamin D, and the other is B12, which we still recommend. We recommend that you take B12. And there's a lot of discussion on that on the website if you want to see what I've written about it recently in the past. But that's the only supplement we take. If I had adrenal insufficiency, in other words, my adrenal glands didn't work, I would take adrenal supplements. If I had thyroid deficiency, I would take thyroid supplements. I can't think of any other supplement offhand, but There are those kind of supplements, but taking concentrated, isolated vitamins and minerals is dangerous. The Cochrane Collaboration, which I talked to you about the first hour, when they estimated the harm done by multivitamins, the ones my mother used to give me every morning to take with my orange juice, which gave me horrible indigestion and burping for the rest of the morning. Taking these one-a-day supplements, if you look at 1 million users, there are in excess of 9,000 deaths by just taking one-a-day supplements. They cause nutritional imbalances. It's not the way that it is intended for you to take in your vitamins, minerals. You're intended to take them in the form of potatoes and sweet potatoes and rice and corn. And these foods are whole as long as they haven't been processed. You don't get beriberi, in other words, thiamine deficiency, until the rice has been processed into white rice. You don't get pellagra until the corn has been processed. The tryptophan has been changed in the corn. You don't get scurvy unless you go out to sea with your boat filled with grains and legumes, and you aren't able to take the fruits and vegetables along, or when you did, they spoiled in 2 weeks. That's the great discovery of the British Empire, was the discovery that if they took limes along, they didn't develop scurvy, which was horribly deadly. And so they became known as the limeys, the British sailors. And the limes would last for months. Nature designed it right the first time. Nature did not make any mistakes. This is an evolution that's gone on for hundreds of millions of years. And we should enjoy it rather than change it. I have to say, every time I see people interfering with natural processes, there's always significant harm. Whether you're digging the top of a mountain and trying to get lithium out of it, or whatever you do. It's a sad world, but we're going to make it. We're going to make it work, because we don't have another one, and we really are. It's going to take a whole army to. We're going to be there. We're going to be there to let our friends and relatives know that life can go on and it can be better. It's just that we need to take some serious action, which is happening.
So Liz says, what is the best time of day to eat starches for optimal sleep?
Oh, I have no idea. I mean, shift workers who work at night, not in the daytime, they eat their starch at noon. I don't think it makes any difference when you eat. I don't think it makes any difference how many meals you have. I don't think it makes any difference of what makes a difference is what you eat. Now, I say that about the number of meals you eat. Actually, gorgers, people who eat 2 or 3 times a day instead of nibblers who may eat 14 times a day. Gorgers have more difficult losing weight and lowering their cholesterol than do nibblers. So those of you out there who are eating all the time, that's good. It's not a bad thing, but it's just eat your favorite starches. Make them, spice them like you like them, so you can eat them. That's the whole thing. It's making it available. At one time, we've tried a lot of things to help people, and they have been really to help people, not to make more money. I could have made more money as a doctor just by a whole bunch of ways that you make money. But one thing we did is we tried to set up a restaurant in Honolulu. Well, fortunately, sanity reached me, and we didn't lose everything for that restaurant. And then we set up a food company in Honolulu, and we lost everything except our house. They couldn't take our house. In other words, we didn't go bankrupt at that time. And then we set up a food company in California, which, by the way, is an extreme success. It's called Dr. McDougall's Right Foods. They have about 40 SKUs, and they're in 8,000 stores across the country, Dr. McDougall's Right Foods. And we, along with very important associates, we developed that business in the early 1990s. But, I also lost everything that time too. And, if the opportunity came up for me to take a risk, I'd do it. And I would take the risk because, and Mary would support me. That's the nice thing about our relationship is she's always there for me and with me, and gives me every opportunity to make my own mistakes.
She's a trooper for sure. Hey, so here's another. We're getting a lot of people that are concerned about their weight being too low today, but this is from Ellen. She says her SMART scale measures her weight at 117 pounds and 15% body fat. And I guess her friends are saying she has an eating disorders, and she wanted to know if she should be concerned if her body fat percentage is too low, and how would she know if she has an eating disorder?
Well, as long as you're eating, you enjoy the food, you don't have an eating disorder. So where eating disorders come about is by a conflict that happens in people. And that is that they eat and they don't get satisfied because it's starch, it's sugar, it's carbohydrate that satisfies the hunger drive. So I recall when I was a young man, I've always been a big eater. And when I was a young man, I would, of course, eat meat and dairy and poultry and oil and so on. That was my diet. And typically what I would do is I'd get big plates of food. The first plate was not satisfying. And of course, a second plate wouldn't be a big deal. And after the second plate of food, I started feeling a little bit stuffed. And by the third plate of food, I got my signals it was time to stop eating. I was overstuffed and in pain. Okay, so you say to yourself, look, I ate and I'm still hungry. I'm out of control. I must have a mental disorder. I must be an obsessive compulsive overeater. Obsessive compulsive overeater. There must be something wrong with me. I need to see a psychiatrist. I need to find out if I got an eating disorder. You got a problem. The problem is you're not eating the food that satisfies your hunger drive. And once you do, it all fits into place. It's simple. It works. So just do it. We used to challenge people for 12 days. Do it for 12 days. What I would tell you is this: is do it for 4 months. If you do it for 4 months, then you have earned the right to come back to me and say the McDougall program doesn't work. And I put that challenge out to thousands of people over the last 50 years, 46 years. I've yet to have, that I can remember, anybody come back to me and said, I did what you said, it didn't work. Lots of people come back to me and say, I heard what you said, I understand it, but I couldn't do it. That's fine. It's not easy. Change is not easy. So I understand that, but I'm happy to say that the things that I've learned that I share with you work. I'm the luckiest doctor in the world. My patients get better. My patients get off drugs. Sick people are on drugs. My patients avoid surgery. Sick people go to surgery. Yeah. So if you're tired of dealing with the medical business and all the aches and pains and pills, fix it. It's the food. It's a starch-based diet you need to eat. You need to leave the animals and oils alone, and preferably less refined food.
Absolutely. There's a question about kombucha from Isabel. Can it be part of her life? She prefers to make it, but sometimes will buy it when she's out and about.
Yeah, I think so.
Yeah.
The idea that kombucha, which I think is made into teas and is some kind of cancer cure miracle, I don't have any evidence to know that's true. But if you want to just include it as a enjoyable part of your meal plan, fine. How does it come, Mary? Do you know?
Well, it's a tea and it's fermented. And so you can buy it, you can make it yourself and let it ferment in your refrigerator or on your counter, or you can buy it.
Do we ever have it?
It's expensive when you buy it at the store. Like a bottle's like $5.
Yeah. I don't like it.
Yeah.
It.
It kind of tastes like alcohol to me. I didn't care for it.
Yeah.
Wonder why people like it. Interesting. So here's a question from Riva. I'm a thin.
I'd like to answer that is people are so ingrained at looking outside of their body for a solution. If it happens to be a pill called kombucha or a vitamin supplement, as opposed to a doctor prescribed pharmacy given drug, they're always looking to the outside for salvation. You're not going to be saved. You got to fix the problem. The problem is malnutrition due to eating the Western diet. That's it, plain and simple. You just got to fix the problem. You fix the food and everything will be fine, which brings me to another story I've told you before, AJ. And that is I used to have a cat. Last time I saw him was October 9th, 2017. He used to come to my back door every day. And most mornings he'd have a gift for me, a little mouse or a mole or a little tiny bird. And look up at me with this animal hanging out of his mouth, and he'd smile. And he'd go, "Look, Dad, what I brought you." Well, that's not my food. And so in the effort of understanding experimentation, let's enroll Einstein in an experiment. Let's take Einstein and let's feed him baked potatoes. What do you think Einstein would do with baked potatoes? He'd bat them around until he starved to death. Okay, that's not fair. That's not the experiment I want to do. I want to see how Einstein would do on living in a diet of baked potatoes. So what I do is I turn them into mashed potatoes. I take a gastric tube, put it down his throat, and I force feed him mashed potatoes for 2 weeks. What do you think is going to happen to Einstein? He'd be lethargic and sick. So I could use some of the techniques that I've been taught to cure diet and lifestyle problems. One thing I could do is I could exercise Einstein. So I'll grab the old dog leash and drag him around the block a couple times a day for a couple of weeks. What do you think will happen? By adding exercise. Okay. So now what I'll do is take the other pillar of the three-legged stool, diet, exercise, and psychological comfort. I'll add that to the program, and I'll give Einstein psychological comfort. In other words, every day for minutes, if not hours, I'll rub his ears and his belly. What do you think is going to happen to Einstein? You got to fix the food. Einstein's a carnivore. That's his diet. Don't you dare raise your carnivorous animals on the McDougall diet. Don't raise your herbivorous children and spouses on Einstein's diet or foods you never feed. Some of the foods that we feed our kids, ourselves, if we fed them to our pets, we'd be arrested. The Humane Society would come after us for animal abuse. But somehow it's okay to give your kids cheese sandwiches and glasses of milk and chicken nuggets and whatever. This is child abuse. I wrote a letter to Santos from Florida about 10 years ago, and they were doing it's in the newsletters, you can find it. They were doing a thing about how every doctor had to turn in, by law, or you get punished as a doctor or a dietitian or psychologist. You had to turn in evidence of child abuse to the government in Florida. And so I wrote him a letter about how I was licensed at that time in the state of Florida to practice medicine. I had my medical degree because I was taking care of the employees of public supermarket. So I had my license. I gave him my license number, and I said I'd like to report abuse that's being done by schools. It's done by nice members of family, like policemen and teachers and priests and not priests, ministers, and they're committing child abuse, and the pain is real. The pain of being overweight, acne, greasy skin, stomach aches, headaches, this is real. And I got no response. I actually sent that off to their bureau on 2 occasions saying, you guys ought to take action. I pointed out child abuse, and if I don't point this out to you, you'll arrest me. I'll be punished. Anyway, you'll find that newsletter on someplace on the website. Look up Florida. Look up Florida. Look up child abuse. I think it was Rick Santos. I think he was governor then when I wrote this.
Okay. All right. So this is from Riva. I am a thin type 1 diabetic and take between 26 and 30 units of insulin per day. Am I at greater risk of breast cancer or any cancer for that matter because I take insulin?
No. It depends on what you eat. The problem with type 1 diabetes is you've lost a very important organ. You now suffer a metabolic handicap because the pancreas has been destroyed in part. And as a result of this metabolic handicap, everything is more damaging to you than, say, if you didn't have the metabolic handicap. Somebody, a diabetic who gets an infection in their toe, they must take immediate action, or they'll get gangrene and they'll lose their leg. I get an infection in my toe because I got all the organs working good. I can wait 6 months before I did anything. Well, big deal. So because you have this metabolic handicap and you are eating, and maybe not you personally, but most type 1 diabetics are eating a diet that kills people, gives people cancer, heart disease, diabetes. Oh, they've already got diabetes. Cancers and all kinds of, that don't have a metabolic handicap. What do you think happens to you? The only patients I've seen, well, first let me start out within 11 to 17 years of diagnosis, most diabetics have suffered a major complication: eye damage, kidney damage, heart attacks, osteoporosis, et cetera. And yeah, you have a higher risk of cancer, but not due to the insulin. It's due to the fact that you have this metabolic handicap, plus you're still eating the rich Western diet. The only patients I've seen with type 1 diabetes who had all their parts working 40 to 50 years later were Walter Kempner's patients. And I had a chance to see a few of them, and they lived on the rice diet, which was rice, fruit juice, and simple sugars. But it was basically the McDougall diet. They didn't stay on the therapeutic rice diet. They stayed on starch-based diet with fruits and vegetables, and everything was functioning. So I think it's a great reward for the patient and for me as a practicing doctor to share this message with type 1 diabetics. Their pancreas will not grow back. But what does happen is that immediately when you switch the food is their insulin requirements become much less. Typically, I'll drop the insulin dose by about a third the night I change their diet, so they don't have hypoglycemic reactions. But they'll always take insulin. I usually use a long-acting insulin like Lantus, and they can get by with 1 shot a day. I don't use insulin pumps. They're very dangerous. They ruin people's lives. I don't use regimes of multiple doses of insulin and pills. They're trying to chase around the blood sugar. We know that it increases the risk of dying, this aggressive treatment. Particularly with type 2 diabetics, we know that's proved by 6 major studies. So as a type 1 diabetics, you got to realize, just like, I've had to face the fact that I had a major stroke when I was 18 and the left side of my body still doesn't work 50 some years later. But I live with that. You have to live with the fact that you lost your pancreas, probably due to cow's milk consumption when you were a child. It's called molecular mimicry. It's where the body attacks the pancreas due to a segment of 17 amino acids on the beta casein component of milk protein. All identified. We know what causes it. But are you told to not feed milk to children? Well, the American Academy of Pediatrics says so. They started saying so in 1986. They started telling people that type 1 diabetes was due to consuming milk. And they recommended that you don't initiate consuming milk in young children. That's a work group from the American Academy of Pediatrics. Oh, people know this, but it's not translated into practice because it's not profitable. That's it. That's the only reason. What do we do is, oh boy, I tell you, the drugs that are being advertised, we watch a lot of cable news, way too much. And the drugs that they advertise, I never imagined that they'd be advertising these kinds of drugs for various kinds of autoimmune diseases. And, it's just absolutely obscene. But of course, these drugs will cost somewhere between $25,000 and $85,000 per year, per patient, for just the drug. But how can they find enough people with rheumatoid arthritis to make a business out of it? Well, they do, obviously. And this is a disease that's easily curable by a dietary change. Crohn's disease, ulcerative colitis, a couple of the other autoimmune diseases that we treat very successfully. If somebody told the truth and put ads on TV that says, if you have these autoimmune diseases, just have to change the food, it'll go away. Who would do that? What company? Would you invest in stocks in such a company? Find me a way to make money. I'll find you a way to change the world.
Nice. You've been going 3 hours. Do you want to stop, or there's 5 more questions?
All right, let's do the 5 and then quit. We've already gone well beyond the point of being obscene.
Well, I never tire of hearing from you. Neither does the audience, because they're still here. This is sort of an interesting question from Olga. Is animal protein and plant protein absorbed the same way by our body? And is animal fat and plant fat stored with the same efficiency?
It's stored with the same efficiency as far as I know. You can do biopsies of people's body fat, like their abdomen, buttocks, or thigh. You can tell the kind of fats that they like to eat. You eat cold water marine fish, you're full of omega-3 fats. You eat Crisco's and margarines, you're full of trans fats. So the body stores fat, regardless of whether it's from a plant or animal, very efficiently. As far as proteins, there is a big difference in plant and animal protein when it comes to raising cholesterol, for example, or your risk of dying of heart disease. Also, when it comes to feeding people who have liver failure and kidney failure, the plant proteins are much kinder on the liver and the kidneys than animal proteins. So the protein certainly makes a difference as to whether it occurs at the level of absorption at the gut. I haven't thought that that's the case, but probably haven't thought about it, or whether it occurs at the actual organ, which is the liver and kidneys. Now that's where the harm comes. But maybe the gut wall is involved in it too. Yeah, there's a big difference between animal protein and vegetable protein as far as bone loss, kidney failure, liver failure, dying of heart disease. It's a big deal. And I think it's true. I think that you can isolate out the proteins and still see the difference. Whereas, maybe the protein's just a marker for the other bad things in the food, cholesterol, the fat, the contamination, et cetera. I think it goes beyond a marker. The different pattern of amino acids are particularly damaging. I know they are with osteoporosis. Animal foods not only are high in protein, which means they're high in amino acids, but they also contain a very exaggerated amount of sulfur-containing amino acids. These would be methionine and cysteine. And methionine and cysteine, they're sulfur-containing amino acids, and they break down into sulfuric acid. So the bones have to deal with that high acid load due to animal food intake. So yeah, big deal. It's a big difference.
Great. Thank you. Okay, so this is from Marie. Could Dr. McDougall please tell me about chronic sinusitis, rhinitis, if you found anything in the diet that works for improving it, like specific foods to eat or avoid? I guess she's had this from environmental hay fever type allergies and lost her sense of smell many years ago when it was bad, and her sense of smell hasn't returned.
Well, that may not be fixable. You might have destroyed the olfactory nerves, what we call nasal hairs. So it might not be fixable, but yeah, there are some things there. First of all, there's all that stuff in the air, all the pollutants, all the plant pollen, all that stuff in the air that's very irritating. So that's an important cause, and of course you need to get an air filter, and that may help and control your environment a bit. The other thing is that when you eat the Western diet, you have a lot of reflux. You know that. Nexium and Prilosec told you that. You got GERD, you got reflux. Well, that reflux is up into the esophagus, into the back of your throat, where it damages the vocal cords. You get hoarseness and cough. And that acid goes up into the sinuses and causes chronic sinusitis. And it's inhaled in the lungs and causes asthma. Every doctor knows this. And so a standard recommendation for doctors taking care of patients who have these problems, loss of enamel from their teeth, hoarseness, cough, bronchitis, sinusitis, asthma. Standard doctor recommendation is to raise the head of your bed so at night you don't have all the acid reflux. And they should go on further and tell you to stop eating acid-producing foods. These are animal foods. Therefore, you need a lot of acid if you're a carnivore like Einstein. Einstein had 7 times more acid concentration in his stomach than I have in mine. Because he's supposed to eat an animal food-based diet, I'm not. So decreasing milk and meat intake is very important as far as reducing the acids. But another implementation that doctors will offer you is antacids. And they'll offer you antacids in the form of proton pump inhibitors. Toxic. These proton pump inhibitors like Prilosec, Nexium, Prevacid, a whole bunch of them out there, sold over the counter. What they do is they inhibit the passage of acid from the body, the bloodstream, into the stomach. Okay? And yeah, that may cure your indigestion, but that acid stays in your body. And so you create a condition of chronic mild metabolic acidosis. It may not be so mild. And as a result, people who take these drugs have an increased risk of fractures related to osteoporosis. Because you decrease the acid in the stomach, they also have an increased risk of stomach cancer. Because they decrease the acid in the stomach, they also have an increased risk of pneumonia, because the bacteria that give you the pneumonia survive in a stomach without sufficient acid. Toxic. I mean, I occasionally will prescribe these drugs for my patients, but it's a last resort. I will have them raise the head of their bed, change their diet, which almost always fixes the problem. The next step would be to take wafer antacids like Tums. And the other thing that I occasionally do is H2 blockers like Tagamet. There's a lot of negative things about those, but nothing's as bad as proton pump inhibitors.
Yeah, thank you. Marianne says, can renal dysfunction be an adverse consequence related to aspartame? And if yes, do you know if mild renal dysfunction can be improved, reversed after stopping it?
I don't know that. I don't recall or have never read that aspartame damages the kidneys. Could be. You can improve your kidney function by changing your diet. We've known this in multiple research studies. They've taken people with proteinuria, protein in the urine, due to leaky kidneys, due to damaged kidneys, particularly in diabetics, and put them on a low protein diet, and the proteinuria goes away. In other words, the integrity of the kidneys is improved just like overnight. If you think aspartame's the problem, then don't eat it. Why would you eat aspartame? What's that for? Weight loss?
I have no idea.
Aspartame is it's an artificial sweetener, so it's a 0-calorie
Oh,
sweetener.
there you go. It's for weight loss, right?
Well, yeah, ostensibly, but it's not. I mean, from the GI Health Summit, none of the doctors are a fan of any of the 0-calorie
You
sweeteners.
shouldn't be taking those
No.
things. Artificial sweeteners are something you should avoid. Instead, take a small teaspoon and put a little bit of brown sugar on your cereal.
Yeah, absolutely.
There's date sugar.
Yeah.
There's all kinds of sugars made from natural products, and we don't recommend any artificial sweeteners at all.
And they're not even been proven effective for weight loss, because they say that it has what's called a nutritive mismatch, that people don't lose weight from them.
Well, the sweetness stimulates insulin production, even though they're non-calorie sweeteners. Insulin drives fat into fat cells. That's one mechanism. So yeah, they're ineffective with weight loss. We used to serve stevia at our program, our live-in program, but we stopped doing that because people got so much gastrointestinal distress from it, and it really doesn't make any difference. Whether you have a teaspoon of stevia or a teaspoon of brown sugar, you're talking about 16 calories difference. You eat 3,000 calories a day. How is that going to make a difference? Now, if you're consuming, 300 calories in a soda that are sugar, that could be a big deal. What's going to happen is you're going to rot your teeth with all that sugar. You're going to raise your triglycerides with all that sugar. You're going to be taking in empty calories. In other words, they don't have vitamins, minerals. It's just empty calories. That's what you're going to be causing by consuming these simple sugars. Plus, the body wants to burn sugar. It's the preferable fuel of the human body. It's called glycolysis. You learned it in high school. The body burns glucose. So if you provide it with glucose, in other words, sugar, it's going to burn that and leave the fat in your body fat. That's what's going to happen. So you're not going to lose weight because the body is being energized by the simple sugars. And your fat isn't going to leave. But high sugar diets don't cause obesity either. I could go into that in some discussion, but let's just leave it at it's not a good idea to eat sugar. And certainly if you want to lose weight, it's not a good idea.
Great, thank you. This is a question I haven't heard before from Lori. I was wondering about using nail polish like gel nails. Is it important to let our nail beds breathe? Can the chemicals in polish be absorbed in our systems?
That's probably a subject I've never even touched on. Mary, do you?
I have no idea either.
Yeah.
I think they recommend that you, when you use the gel on your nails, that you let them breathe naturally without the gel stuff on them for a few weeks before you use it again. instead of putting it right back on. But I'm not sure of the reason why. But I would imagine it would be because of the chemicals in the gel polish, because they're very strong.
And they may have blocked the absorption of estrogen.
Yeah.
We had a plant-based dermatologist on the show on the weekend, and she said the problem is the light that they use, the light that your hands go in.
Yeah.
And so there's been cases of finger cancer with that. I don't know. I still do it. What can I tell you? I live dangerously.
Well, you know, AJ, it's just a matter of making choices, and you just hope your choices result in more good than harm. Just like when people ask me about plastic surgery. You know, I say, you only got one life to live. You're not happy with the way you look, fix it. Find yourself an artist, though. Don't go to just any plastic surgeon's office. Find somebody who's passionate about their business, who's a creative person, who's an artist.
Yeah, don't buy a Groupon.
Hmm?
Don't buy a Groupon for that.
Anyway, you want to, fix it. You've got 85 years on this planet. You might as well enjoy them the best you can.
Right. Okay. So this is the last question. By last question, there's a million questions in the chat, but I can't help
All right.
people. If they don't send them in, they got to take the time to send them in, because it's not fair. The people that took the time to send them in.
Before I end, I would like to make sure that I'm presenting for you something that you will enjoy and benefit from.
Oh, I love it. I mean, I can't imagine the 400 people watching. They're still here. They must enjoy it. Am I right?
You know, the presentation I gave last time on precocious puberty, how the food affects the estrogen levels, that was a lecture I've always wanted to give and put together, and you've given me the opportunity to do it. Just like the lecture today on breast cancer. I've always wanted to put together a lecture, AJ, where I could say, if you were sitting with me in my office, this is what I want you to know. And so I did that with the breast cancer lecture. Next time, I don't know, maybe we'll do osteoporosis. I would like to be able to have a doctor-patient relationship with you through AJ's medium, and have a chance to do some of the things that I was never able to do in the past. And now I have the time. I certainly have the knowledge, where I'd like to make it real personal. And I'd like to make it personal and professional. I want to be your doctor. And you can assure yourself that everything I tell you, I've researched carefully, and I can defend. Unless I make a mistake.
Elizabeth Ann says, we love your talks, Dr. McDougall. Bless you for taking the time to share them with us. So this is a question from, Diane. Okay, it's really, really long, so I'm just going to get to the question part. What is the maximum daily amount of saturated fat allowed in my diet? Eliminating all saturated fat is impossible, considering I consume flax seeds, chia seeds, tofu, and some other foods important for breast health.
I don't know. I don't know what the maximum. I don't think there's a level. I think that the fewer fats you eat, the better off you're going to be in terms of diabetes and obesity. It's just too complicated a question to answer, because you're getting down to micro details. You need to focus on the real problem, which is the food. Yeah, the food's high in cholesterol. Yeah, the food's low in fiber. Yeah, the food's high in chemical contaminants. It's the basic food. It's got all kinds of things that we've identified as the culprits, but it's really not the cholesterol. It's not the sodium. It's not the simple sugar. It's the wrong food. It's just not what people were designed to eat. That's where you ought to focus your attention, and instead of trying to find out what you can get away with. Oh boy, I can get away with 10 grams of saturated fat. Dr. McDougall
and you wouldn't have to eat those things. You don't have to eat flax seeds.
No.
You don't have to eat tofu.
Well, this person, I would guess, is still looking to finding a pill to solve their problems.
Yeah.
Well, she also wanted to know what's the maximum amount of grams of sugar you could have each day.
I don't know. I mean, let me just tell you that let's just say it depends on your calorie intake. Let's just say the sugars are, you eat a starch-based diet. Well, if the sugars come from potatoes, rice, corn, and so on, 80% of those 3,000 calories come from sugar. These starches are 80% carbohydrate, sugar. So that's 2,400 calories of sugar you can eat a day. Again, you're making micro details out of an obvious an obvious message that you need to do, which is you eat a starch-based diet. You look at your plate, 90% of the food is starch. Few fruits, few vegetables, no turkeys, no pigs, no cows, no chickens, no ice cream cones. So, it's just, don't make a big deal out of it, but bigger than it has to be made. You love potatoes, you love bread, you love pasta, you love corn. That's because it's natural. You are a starch eater. Human beings are starch eaters. My cat Einstein hates potatoes.
My dog Bailey loves them. She loves rice, potatoes, sweet potatoes.
Got a weird cat.
No, she's not a cat. She's a dog.
Oh, well, see, dogs are omnivores. A dog is a true omnivore. And by the way, it's an interesting story about how dogs developed from wolves. And what happened was wolves are true carnivores. But because the wolves hung around the campfires and ate the scraps from the people, they developed an ability to digest starch through development of the production of alpha amylase in their mouth and in their stomach. And that's one of the main distinctions between a wolf and a dog, is the ability to digest starch.
Right.
And that occurred as a consequence of hanging around with people. That's how you got a dog. And
What's
so
interesting though is it's not that she'll just eat them. She loves them. I mean, if you put down, and we've done this, we've put down like rice and sweet potatoes and her vegan kibble, and she just loves sweet potatoes.
Well, one of the basic treatments for dog lovers when they get into trouble is to put the dog on a low protein diet. This is a standard recommendation by veterinarians, and the dogs spring back to life if you switch them to a low protein diet. In other words, you take them off the animal meats and you put them on sweet potatoes, and the kidneys function better, the liver functions better, the whole body works better. Arthritis often goes away. It's an amazing treatment. And it's a standard recommendation. I used to have a radio show in Honolulu called To Your Health, I think it was called. And there was a show that appeared just before me called Pets and Vets. And I sit and listen to Pets and Vets, the veterinarians, and they would talk about all the wonderful things they did to dogs by switching them to a low protein diet, by adding the foods that your dog likes, AJ. And I would get on my show afterwards. I'd say, why do veterinarians know all this and somehow human doctors don't? Well, I don't know.
Yep.
Human doctors, so little has changed. I know a lot of you out there are very optimistic about what's happening and happened. We have the American College of Lifestyle Medicine and more doctors interested in the subject. But really true dietary therapy where a doctor treats you with food is extremely rare. Walter Kempner used to do it. Nathan Pritikin used to do it. We do it. Weimar Institute in California still does it. There are just a few places that do it. Most of the dietitians and doctors out there who are getting into plant nutrition are still at a very theoretical level, and they haven't really learned how to take care of patients with food. And that's a lot different than learning the biochemical formulas that occur with the interaction of food in the human body, which is basically what doctors know, is they know biochemical formulas. You need to know diet therapy. And I've written a lot about it. I have a course on our website on diet therapy, which is CME approved. You get credit for it. I also have a course on the starch solution, which you would really enjoy. You get credit for that too. But, we got a long way to go before doctors actually use diet to cure 90% of the problems out there in our society. Of course, that would take a big hit on big farm and big hospital and big medical doctor, and it's not going to happen because there's just too much money in doing the wrong thing. It's the money. It's not a conspiracy. It's just money. Just human beings acting like human beings.
Right. There's a wonderful comment in the chat from Kim. Thank you so much to the McDougalls for their time. You've changed my life for the better, and I'm so grateful to have found you. Your work is amazing, and I appreciate all the things you do to make us healthier and to make our planet better for our children and grandchildren.
Well, what you can do is you can join the Army. We're trying to make the world a better place. And Mary and I have been at it for 46 years. And now, you know, we used to think that all you had to do is tell people why they were overweight, diabetic, had breast cancer, et cetera. And they'd respond. Well, they didn't. And now a very simple message to save the planet is fix the food. And so far, my waving hand up there asking for attention has not been recognized. Let's just hope that there's the possibility of having a crack to let the light in.
Do you think people will ever get your message? I mean, it's ridiculous that it must drive you crazy, because it drives me crazy.
You know, AJ, I went through a cycle where in the 1970s, popular was Nathan Pritikin and James Anderson, the University of Kentucky, treating diabetics this way, and you know, Dennis Burkitt. And back in the 1970s, Atkins was condemned. You know, at the end of the 1990s, I'd written several national best-selling books for Penwood Putnam, which is with Dutton now. And my editors came to me in the 1990s, even after being one of the top 5% of authors in their company, came to me and said, you're going to have to change your style of writing. We want you to start writing books that are high protein, high fat, low carb, because we believe that's the trend. And I said, you're crazy. I said, first of all, I don't do this just to make money on books. I do this because I believe it's true. And I said, second of all, the science is absolutely clear that these diets are harmful. It would never happen. Boy, was I wrong. And I paid the price for it too, but I would never compromise myself, you know that. And what happened was in the 80s and 90s and still in the 2000s, we have the resurgence of the Atkins diet. And now I think we're going in the other way in the pendulum. I think for whatever reason, it's swinging in the right direction. Will it get to a level where it really makes a difference? I don't know. But one thing to think about is that with droughts and floods and fires, you know, the planet is changing, and food production is one of the first things that's going to be in trouble. So you're not going to be able to afford to eat the pigs and cows and cheeses and so on that you enjoyed in the past. You might as well learn the McDougall diet now when it's your choice, because you know, you might be lucky someday just to get enough potatoes and corn and rice and beans to eat so you don't starve. The world's changing, but we can make it better. We can fix it. We just got to get together and I don't know, get some good luck.
Yeah. Well, I appreciate your optimism.
You know, AJ, I can't be any other way, because it'd be too depressing. I have to, it's just like I've always believed that what I'm doing is right and it's worth the trouble to do. I've never wavered, as most of you know. You know, I have to take the attitude that, you know, the human being has the potential to fix very serious problems. I know a lot of people don't agree with me, but I'm going to take that attitude because it serves me and everybody else well.
Well, we appreciate so much your work and what you do. This has been
AJ, thank you very much for giving us the opportunity to talk to so many nice folks. I present all my new material with you. And next time we'll maybe do it on osteoporosis.
Well, there's so many things. Yeah, there's so many different parts.
Monday, right?
No, it's just January, Mary.
January 3rd, the first Monday, the McDougalls will grace us with their presence for McDougall Mondays, the first Monday of the month, which is January 3rd, which is a Monday, 2022, first Monday of the year.
Well, I hope you can share the breast cancer treatment options that I gave in the first part of the presentation today. Share it with people you know need this. I probably hear from 2 or 3 patients with breast cancer, sometimes daily. You know, certainly every week I hear from half a dozen women who've developed breast cancer and want some help. And I'm happy to help them. I mean, I give these services away free. I don't become your doctor unless you've attended the McDougall program, and then I'm officially your doctor. That's the only way you become part of our practice officially. And then I can get real serious. I can talk to your own doctors, which I do sometimes, tell them that I disagree, but you know, unless we have that kind of official doctor-patient relationship, which is only established by you attending the 12-day program, will I have the option and the opportunity to help you that much. But if I tell you, get within my grasp and I'm going to take you all the way to the end, you know, if I believe it's right, I'll fight for you.
And isn't the next McDougall program, does it still have a few openings in January? I know there's.
I don't know if it does. I haven't checked with Heather, but
I would imagine.
yeah.
If not, Heather will manage to squeeze.
Yeah, she has some
few
way of
people-
squeezing a
she-
couple
she
people
has
in.
a few ways of squeezing people in.
Yeah.
Nice.
Especially if you're needy and you use AJ's name. You say,
That's right.
I'm one of Chef AJ's followers, and then it makes a big difference.
That's fantastic. It's so great. Well, so great. This will be probably the last time we see you this year, but thank you so much and have a wonderful holiday.
Well, we look forward to
Thank you. You too. And have fun with your Christmas dinner. It sounds.
I know it's going to be so untraditional with all those different ethnicities, but it's
gonna be fun.
Hey, you know, there's always overnight mail.
in fact, yeah, it's sending things in dry ice. I wish we lived closer. Yeah, that's just. But you're happy in Oregon now.
It's okay. I can't say it's where we're going to stay for very much longer, but yeah, it's okay. It's a nice place to live, and we have the advantage of our son and daughter-in-law too.
But you got to be near some of the grandchildren.
Yeah, we have. We love our grandkids, and we've developed some pretty good relationships with them over the years.
Well, where would you go? Where on the planet would you prefer to live if you could live anywhere?
Well, you know, we're kind of thinking of that maybe. Well, I don't want to say. I can't say.
Oh no. Okay.
But you know, we're kind of getting a little bit homesick for Santa Rosa, California, and you know, we had to move because of the fires. And
Yeah, but now somebody's in your house.
yeah, Heather's in the new house. And you know what? She built a granny unit.
That's great. Oh,
So
wow.
yes, I'm the only grannies that they'd have. maybe she'll invite us in. I don't know.
Well, California would love to have you back. So anywhere you move. Is
I love California. I loved Hawaii too. Those are different parts of our lives. And Oregon's been a nice place to live. I don't want to say anything negative about it because there's nothing negative to say.
It's just kind of cold, isn't it?
Not really, not cold enough. We were going to have the grandkids up skiing this weekend.
Well, you wouldn't wear your short sleeve shirt today, so obviously it's cold.
It is cold. It's colder than I like it to be.
Yeah. Well, it's cold, it's rainy, but it's supposed to be. You know, that's the thing about Portland. When I used to come here and sell books, which I did back in the 1980s, I was here at least once a month. I never saw a sunny day in Portland. That was 20 years ago. And now, you know, it's something we look forward to, a cloudy, rainy day. They become quite unusual. And of course, you know why that is. And of course, you know what we can do about it. You stop eating the most destructive item of the animal foods. No, I'm not going to say particular, because they're all toxic to the environment.
Yeah.
We can do this. We can fix this. We got to fix this. We have no choice. It's not like unless aliens come from outer space and save us, we've got to save ourselves.
Amen. Thank you so much, Dr.
Thank
McDougall and Mary.
you. You might think about putting this up because we kind of.
Oh, it goes up right away. It goes up right away.
Okay. Well,
It never leaves. It never leaves.
Tell people they can stop watching anytime they get tired. It's the same old dribble.
Nobody gets tired of you. We should just have all McDougalls all the time, like 24 hours.
That wouldn't be any fun.
That's great.
I love controversy too. So
You do. That's true. Well, we look forward to seeing you next year. Thank you so much again.
all right, AJ, you have a wonderful holiday, and all you folks out there, you know, really been nice of you to share with us and spend a little time and spread the good news.
Yeah.
Great. Take care. And thanks everyone for watching another episode of Chef AJ Live. Please come back tomorrow at 11 a.m. Pacific time when my guest is John Kohler. Take care, everybody.